We live in a time where people are not getting treatment for brain conditions, right? Biological conditions, because of a bias that was created around psychiatric care from first, like medieval times, where if you're possessed or there's something wrong with your brain, there's something wrong with you. So don't not access that if you need it.
Welcome back to the Trish podcast. I'm here with one of my favorite guests of all time, and also just very fitting, my pregnancy check-in with Dr. Drew.
Pregnancy check-in. This is how I like to call myself. I'm here to check in the pregnancy.
You're kind of that person, though.
I'm sort of jack of all trades. But so congratulations.
Thank you.
You're about to enter real parenthood.
Yes, 1 to 2.
So you knew we had triplets, right? Do you know that?
No.
Yeah. Oh, yeah.
Oh, I didn't. I knew you had 3 kids. I didn't know they were all the same age.
Triplets. And it was insanity. So I got a sort of a crash course on early child development and raising babies and all that kind of good stuff. Yeah, I thought I understood it. I'm an internist, so I had a certain amount of pediatric exposure, but I really, until I had babies, I did not know pediatrics.
No.
And then I had one son that had like one thing after another medically, not anything genetic. He was a broken bones and all that kind of stuff. And so I got a big exposure to childhood illnesses.
Did you guys plan it? 3?
It was a fertility campaign, yeah.
Okay.
Yeah.
So it just, back in the day when people just got like 8 babies and stuff like that, was it just because they put so many in?
Well, yeah, it's a great question, because what they did sort of in vitro came in the late 80s, early 90s, right? And in the early 90s, they determined that when they put 5 embryos in, they had the highest probability of 1. Which was dumb. And so from about 1990 to 1995, you have all these super multiples because they put in 5. And we actually started with 4, and 1's just absorbed by itself. And then they try to get you to reduce.
What's that?
It's called a selective reduction.
Take 1 out? Oh my gosh.
I know. It was intense.
Wow.
Yeah, we were like, we can't do.
How is that possible?
Plus, you put the whole pregnancy at risk when you do that.
Right? Don't they have to stay? They have to stay in there, right? Or can they take 1 out?
They inject one with potassium and it absorbs essentially, but it can cause labor and the whole thing can go.
Oh my gosh! You're like, we'll take all 3.
We're just like, we can't do that. We just can't do it.
Did you have help with triplets?
Well, that's what I want to tell you about, because you're about to enter real parenthood here. And we always giggled at singlets, singlet parents, like they don't know.
Right, one is cute.
And you've done it close enough together that you're going to get sort of the real deal experience.
I know, I'm so nervous.
It's hard. The next 3 years especially are really crazy. You just kind of go into survival mode.
Oh no.
And you'll do it. You will do it. Humans have done it throughout history. I swear to God, you'll do it. Don't worry. But it is intense. It just is.
Yeah.
And you almost won't notice how intense it is. It's like a little bit of boiling the frog, because you just
get through it.
You just leap into parent mode, and your body just does it, and you look back and you go, how did I do that? But yes, get help. That is my every time I talk to parents, if you can, either somebody from the gene pool, right, parent, grandparent, anybody, somebody from the gene pool, and or if you can afford it, hired help, it makes all the difference in the world. I mean, think about it with 1. You were sort of 2-on-1 most of the time.
Yeah.
Now the best you're going to be is 2-on-2.
Oh my gosh.
So at least if you get into some 3-on-2, you'll be better off.
Yeah, that's what I keep telling him. He's like super dad, so he can do everything, but I'm like not super mom, and like I struggled with the first one, so I'm just like, I think we might need help.
Even super dad needs help.
Yeah.
Don't be dumb dad. Be super dad and ask for help. Delegate.
Because he's super dad and super husband too. He like caters to me, caters to the family. It's like, okay, we have to have
This is great. This is great news, by the way. Congratulations.
Thank you.
This is like what you call a stress test.
Yeah, but we definitely, I feel like you hear so many people like get that help, and I'm like, maybe we need that for sure, just to like, because we both work too, you know what I mean? So it's just,
of course. And if you don't, especially if you don't have a parent or something, a grandparent, then come in and really be a part of this.
Yeah.
You have to have coverage. It just gets dangerous.
Yeah. Well,
People don't understand that. It's like, like I said, 2-on-1 is sort of what you want. Like with us, the best we ever were was 3-on-3.
Wow.
Like we were never 6-on-3.
Right.
It never happened. We were often 2-on-3.
Wow. And were you working? You were working.
I was severe workaholic back in those days.
Wow.
Severe.
So you had the babies,
So-
you had the triplets, and you're just like, I'm back to work right now. You didn't take like paternity leave or anything?
Oh, I was scared shitless because I was like, 3, how am I going to afford this? College is blah, blah, blah. I was going crazy
right.
and paying the nannies and all that stuff.
Yeah.
The help. Oh my God, I'm having PTSD just thinking about it. And my days were, I would get up at about 5 a.m. I did intensive care medicine. So I was taking care of ICU patients. I would do inpatient hospital care. Then about 8 o'clock, I would do outpatient medicine until 2 o'clock. And then I would go to the psychiatric hospital until 10 o'clock.
Oh my gosh.
And on a day off on the weekends, I did nursing home rounds for 6 to 8 hours.
Oh my gosh.
It was insane. I do not recommend it, but it gave me this incredible experience, and this is why I'm just constantly trying to give back what I know, because now, say an internist like myself, you can't even forget doing ICU and hospital work. You can't even do hospital work and outpatient. It's all siloed now. Mm-hmm. And then the psychiatric job would have been something totally different that you couldn't do all these other things with. And it bothers me because no one gets to see this incredible spectrum of the human experience that you kind of need to know what people are all about and to have good judgment and things. So I'm worried about that. In any event, meantime, I feel grateful for that crazy experience.
Yeah.
And I'm going to give it all back. Give it all as much as I can.
Well, I didn't know that about you. We were talking about that before because you were like checking out my swollenness, and I was just like, but you're not. I was telling you, like, I have a back pain, but I know you're not a physical doctor. You're like, I am a physical doctor.
Yeah, I do all of it.
Which I feel like I know so much about you. I've watched all your shows, and I've never once heard that.
Well, think about what I did in celebrity rehab, right? Was the first thing I did on those patients. I did a physical exam on them.
Oh, but I feel like that's like generic, right? Every doctor can do it, or anybody can do it.
No.
Oh.
No. And psychiatrists generally won't even do that, even though they could. They get so far away from that they wouldn't do that. So, and addiction medicine, everyone's so freaking sick medically and psychiatrically. You really need both. I'm always trying to sort out, what's brain, what's addiction, what's psychiatric, what's medical, what's going on with their liver metabolism. To me, it requires it to do it well.
Yeah, they
have seizures, and they had seizuring. Remember, Mindy had a seizure, and that's all stuff that I deal with all the time.
That was such a wild show when I think about that. I'm like, that show is. How did you transition? So you were like just a doctor, you were doing all those things, and how'd you get on TV?
Oh, these are long stories. Even how I got into addiction medicine was a long story. These are all accidents. I mean, things I did not intend.
Oh.
I just thought I was going to be in an office or in a hospital working. My dad was a doctor. I just saw what he did. I thought that's what I was going to do.
Yeah.
Nope, not so much. I started doing radio in 1983, 1 day a week. A lot of it was motivated by Dr. Anthony Fauci, who at the time was kind of my hero, and I was working on AIDS patients a lot. If you were in training in those years, you had AIDS patients all over the place.
Wow.
And here I was, 24 years old, fourth-year medical student, telling a young, often like artistic and skilled and very accomplished young male, he had 6 months to live.
Oh my gosh.
It was every day. And it was never wrong. It was the most incredible thing. And there's no one here to tell the story. They're all gone except people like us that did the work. And it was mostly people in training because the guys that were out didn't know what to do with this. It was evolving so fast, and I was in the middle of it. I was there when we opened the first AZT boxes. I'll never forget it.
Wow.
But no one was talking to young people about it. No one. I remember coming in there the first night on radio. I'm like, you've not heard about what's happening? You're worried about herpes, and this thing is with 100% fatality rate is coming at you? Oh my God, I need to keep coming back.
Wow.
So I did it one night a week for 10 years for free. I thought it was fun. I got to be interesting people, and I thought I was doing community service.
Yeah.
And then all of a sudden, I went to 5 nights a week. And then all of a sudden, the TV show producers showed up. These guys that wanted to make a nighttime talk show out of it. Did you ever see it on MTV?
Yes.
Yeah. And I was like, what's a TV show? I'll do that. That sounds interesting.
Wow.
Yeah. And it's just been doors open. I go through them and see if I can do something worthwhile with it.
Were you having like an agent or something, or someone just came to you and was like,
you know what? At that point, it's funny. I had a conversation. It was my manager, and he died a couple of years ago. And I was having a conversation with the woman that worked with him through many of these years. And I said, God, you want to hear the story? It's kind of interesting. Yeah?
Yeah, of course.
So we were here to talk about pregnancy. And here
No,
I'm talking
I
about
always want to know about you. I always was like, does anyone check in on Dr. Drew? Like, how's Dr. Drew doing? How's his life?
Oh my God, I knew you were a friend. He remember Kennedy from MTV? She's on Fox. Because people that know her from Fox Business and Fox News don't know she was on MTV as a VJ for many, many years. Before that, she worked at our radio station, and she was an intern, and then she had a show that followed Loveline. And so she would hang out with us all the time. And after she went to MTV, she came back to be a guest, and we were sort of so proud of her and stuff, and she came in with her manager. And this guy kind of pulls me aside and goes, "Hey, I think I could help you." I'm like, "Whoa, what is that? I don't need help. What's going on here? Who are you? What is this?" And he goes, he could see I was like, well, "Come on now." And it's so funny. I remember at that point he also goes, "Well, what do you want to be doing in 10 years?" And I remember the thought in my head was, well, I certainly won't be doing this.
Wow, really?
Yeah, I had no idea.
Oh my gosh.
I remember vividly going, not radio.
Oh my God. So it didn't bite you right away. You weren't like, this is what I meant to do.
No. And he goes, let me just kind of see what I can do, and I'll just kind of stay in touch. And he was the one that really got the TV thing together.
Wow. And you're just like, okay, this is what we're doing.
That's what he said. And I was like, well, what is that? How does that work? Oh, we had another funny part of this. I was doing radio with Ricky Rackman at the time, and he had trouble making a deal. And so everyone came to me and went, "Who do you want to co-host with on TV?" And I'm like, I don't, what is TV? I don't even know.
I love that they were asking you, though. It's like,
I was like, that's never been asked of me before. And I remember I was out running one day, and I had this thought, I can tell you this straight, the spot where I was. And I go, God, that guy that does Mr. Burcham in the morning, I bet he could do it. He was Adam Carolla. And so there's a long story how they got him back from New York. He was covering the MTV Video Music Awards at the time.
Yeah, that's a random part. Was he doing the Man Show at the time?
No, this is before. A decade before that.
Wait, really?
Yeah, maybe 10 years before that.
Is this the 80s then?
This is the early 90s. This is like, 90s. Well, you know what, to be fair, this is probably 95.
Okay.
And Man Show was about 99, 2000.
Yeah, okay, that makes sense.
So maybe 5 years before. Yeah, but Man Show happened because of Loveline. That's why that happened.
It's a weird leap.
I know.
Yeah.
I know. It was because he and Jimmy, Adam and Jimmy, were on the morning show on the radio station where we were.
See, I didn't know any of that. Okay.
Yeah, and that's how they became friends, and that's how I'd heard Adam. And I actually had him on Loveline one night as Mr. Burcham, not as Adam Carolla, as Mr. Burcham. But I thought, I bet that guy could do it. So we, got together. They go, okay, next Saturday we're going to film a pilot. It's like 4 days later, and they throw us in a makeup booth and they go, work out your relationship. We're going to start filming in an hour.
Oh my God.
And I remember we filmed for like 9 hours. And at the end of that day, the stage manager came up to us and goes, "How many years you guys been working together?" And we went, we just met this morning.
Wow, really?
Yeah.
Oh, that's for saying meeting in person because you only did the radio. Okay, got it.
Yeah, and then she was like, "Oh, this is gonna go," and I was like, "All right."
And what, like, that's so interesting to me because I always just thought like how you found him is like so because he wasn't a psychologist or anything like that. So
no, he was.
Comedian.
I always had. It was always the show was always kind of. The show went through many incarnations, but the radio show in my mind was always kind of a parent-child conflict, or what we later started calling the Gainsburger and the pill. In other words, like if you want to get a dog to eat a pill, you can't just hand it the pill. You have to wrap it in something, turkey or something.
Oh, okay.
So I'm the pill, Adam's the Gainsburger, and so and in fact through
you do that well.
This is you should be. I think you're interviewing me. This is awesome.
No, I love it. I love knowing these things about you.
We got lots more of this.
Yeah.
Many years. And so what was I going to tell you about this whole philosophy? Oh, it's gone.
Pill.
Yeah,
child.
Yep, got it.
Parent.
The way the older brain works is things come back. They're not in there all the time.
Pregnancy brain too.
Yeah, yeah. It is very similar. It's all that progesterone. So across the sort of 10 years of the sort of really serious phase of the AIDS epidemic, people studied how to change health behavior with messaging, because we realized we were doing a great job of getting people to know, young people particularly, to know what HIV was and how it was transmitted. They all knew it. They could articulate it. Mm-hmm. Didn't change their behavior at all. Mm. And so their whole field developed of changing health behavior. And what they found was, lo and behold, was that if you had a relatable case, like somebody, their age or their whatever, so that they could relate to, that who is making some bad choices. Consequences incur. Someone explain those consequences, and then you sort of wrap it in humor and music. Done. It changes their behavior.
Interesting.
And what was shocking to me, that was by think about that, by like 89, 90, that was now a discipline had developed around this. Because we understood you can't use fear, don't use facts, gotta use cases and cultural material. When COVID came, we just threw it all out the window and went back to Panicsville. It's that was
freaked out.
Shocking to me. It was shocking.
It was
one of the
crazy.
many shocking things. There were so many crazy things.
Looking back, yeah, it's like we all just kind of like followed whatever, just like drones.
Huge mistake.
Yeah.
Huge mistake. Don't do that again. It was all of us. We should all question. We didn't know. What was happening and what was. Now we should know what's happening to us.
Yeah, but like you said, it's kind of similar to that, right? Like, back then everyone's like, we don't really know, but so now we know. And we're like, we'll just follow. But I feel like if it happened again, like this election, right? Like someone's like lockdown. I feel like nobody would take it seriously, right? Nobody would actually do lockdown or anything.
Well, that's one of the fears, right? It's all this vaccine hesitancy is coming in now because they don't feel they can trust the information they're getting. And on one hand, not trusting. So they're doing two things to us that who knew they could do, but with social media and stuff, it's much easier than it used to be, which is they use sort of propaganda to amplify our behavior and create mobs, and then they use cancellation to mobilize those mobs and silence ideas they don't like. And that is not, first of all, it's not this country, and secondly, it's not healthy for people.
Yeah, but it's like, how do you know which information is like legit?
It's really hard. Yeah. It's really hard. Well, the one thing I kept saying over and over again is you and your doctor should be making these decisions, not these people from on high, you and your doctor. But the doctors were so freaked out, they weren't willing to do their job.
Yeah, they're just like, just do this.
Well, not even just do this. It was like, go home, come back when you're blue. It's like, what?
Right.
What?
No, it's wild out there. Well, did you mention Dr. Fauci earlier? You knew him in the 80s? Is that what you said?
He was very instrumental in the AIDS epidemic, and he was a great North Star. And by the way, when this all happened, I kept saying early in the pandemic, just listen to Dr. Fauci, let him be your North Star, listen to the CDC. And of course, then I started screaming about panic, and I could tell somebody was manipulating us, and I started going crazy about that. But I'd always say, but listen to Fauci. Then people took videos of me saying, being angry and upset about the panic and cutting off the CDC and the Fauci part.
Yeah. They're like, Dr. Drew. Why, again, I don't think people know. I don't think of you as a TV doctor. I just don't think people think of you as like a real doctor,
Probably. And I do. You can talk to my patients. They think me as a real doctor. In fact, I was just texting with one as I walked in.
Wait, so you still have patients?
Yeah.
Oh.
I do general medicine. But all my patients are people I've followed general medicine from a general medicine standpoint for like 30 plus years. So they're all in their 80s, 90s, close to 100, some of them. So this on the way over, I was dealing with somebody who's 96 and somebody who's 83.
So in like 10 years, you're not going to have patients, probably.
Well, or I can start taking new ones again.
No, I feel like you're just so busy. Like I am
busy, but I can never not practice medicine. It'd be the oddest thing in the world for me. It was bad. It was hard enough for me to let go of all the different things I was doing.
Right.
And now the world sort of made it so you were not allowed to do all those things. But I think I would have done all the credentialing and stuff to keep doing it if I didn't have other things I was interested in.
And you were keeping up with them all through the decades of doing rehab and all that stuff like that.
Yeah.
What do people recognize you for when they see you on the streets?
It's an odd thing. And let me just say, that was my team from the hospital that I brought up, and Shelley and Bob and those guys.
Oh.
Those are people I worked with on a daily basis at the hospital. Sasha was my nurse.
Bob looked like definitely like a TV person, just like someone meant for TV
he was
only.
a rock star back in the day when he was a severe heroin addict.
Oh.
And it was kind of his idea to do this. He was one that convinced me we should do it.
He looked cool. You definitely wanted to listen to him. You're like, he kind of knows.
He knows what's up. He knows what's up. So how people know me is really an interesting thing, right? So I get to witness it kind of go up and down depending on sort of what's on TV and what's popular and whatnot. Mm-hmm. And there's periods of time where I can be incognito. I think that's kind of officially over because I've been in so many different people's lives, different settings.
You're everywhere.
So yeah. And so if I'm talking to somebody who's, say, 40 and 45 and above particularly, I know immediately it's going to be Loveline.
Yeah. That was massive.
But not only that, there's a new thing going on with them where they are overwhelmed with nostalgia for the 90s. So they just want the 90s back.
Yeah.
You're not young. You're too young for that.
I remember Loveline because I was watching Howard Stern. I was definitely like too young, but I was definitely watching like Howard Stern on E and Loveline, all those things like that. Yeah,
that was us. We were all part of that same phenomenon.
I was like 10, but
I I did that show at your mom's house, Dr. Drew After Dark, which was sort of like Loveline, and it did fine, but it was not. Those same people that say bring Loveline back were not listening.
Maybe they didn't know where to find it. Because I tried to look after you left, and I was like, where do I listen? And I'm pretty savvy, but I was like, I didn't know it was a YouTube channel. I thought it was like a radio thing or something like that. And I was just
it was YouTube at your mom's house, but now I'm doing YouTube and Rumble and all this stuff. It's called Ask Dr. Drew.
You're on Rumble?
I'm on Rumble, yeah.
Oh my God, I love that. I feel like that's where all like the spicy, controversial people are. Yeah.
Well, I've been interviewing people that have been canceled. That's all I've been doing. And if you've been canceled, I'm going to talk to you.
Wait,
probably.
Really?
Yeah, because every one of them I've learned something from. Now, I've not agreed with everything they've said. Like what really came through to me is when about a year and a half ago, I interviewed Robert Kennedy, RFK Jr.
I don't know anything about him. He's canceled?
Well, he's running for president.
Oh, I didn't know.
Okay, he's one of there's three candidates. He's the third candidate.
Okay.
And he has been very controversial because they say he's anti this and anti that.
Okay.
And I knew nothing about him really, and I interviewed him, and I learned a lot.
Oh my gosh.
And at the end, he goes, "You're so courageous. It's so brave that you talk to me." And I went, "You have to be brave to talk to another human being on a
kind of yeah." It's sad.
Sorry. No,
it's sad, but
that's not. I can't live like that. So I immediately went, "Oh, I'm gonna have to interview everybody."
Yeah.
So I went the other direction and have uncovered. I knew about the fact that the 6 feet distancing thing was nothing. Almost 2 years ago, because I talked to somebody who was in the room when they made the decision to do that, and it was just completely out of thin air.
They just made it up.
They made it up, and I was like, now I know that.
Yeah.
And this guy was thoroughly canceled for having some strong opinions.
Yeah, I guess you really don't care because, like, me too. I was canceled and you interviewed me, but you don't get that. Like, the hate doesn't affect you, or do you not see the comments because you have a producer?
No, I do, but they get through to you no matter what. You know how it is.
Yeah, but you just don't care.
No. It's impossible not to care.
I care. Yeah. Like, don't cancel me.
Yeah, it's impossible not to care. You get used to it, and you sort of find your core, you find your center that you can walk through some of it. At first you think, oh my God, something's wrong with me. I did something wrong. My bad. And then you start going, no, wait a minute. Like for instance, each of these folks I'm interviewing all are decorated professionals with thousands of publications and are those are the ones that they canceled, the ones that were a threat to them, the one that could actually have an authority to challenge their point of view. Those were the ones they took down the hardest.
Okay, that makes more sense. I thought we were talking about like the Andrew Tates or something you're interviewing.
No, I'm not, but I would. Now I'm at the point where I'm like, I don't look forward to that. I know it's tough. But let me finish the question you asked, which is the
what people know
me from. If it's a 35-year-old female, it is Teen Mom.
Love Teen Mom.
100% of the time. If it is a younger, like 18 to 25, it's your mom's house. It's
so they're the ones watching the new.
Yeah, which is good. That's who I wanted to reach with that stuff.
Right.
If it is, I had I had 2 popular shows with Southerners and particularly black females in that stretch. I had a daytime talk show.
You did?
Yeah.
What years is that? I feel like
2010.
Really?
Yeah, and then at the same time, I was on HLN every night. So I was on CNN for 10 years.
Oh my gosh, I didn't know.
Yeah, and that show had its own sort of fan base to it. So
2009 to 2015, I blacked out. I don't remember any pop culture. I was definitely like in a ditch somewhere. So I don't remember.
Well, you know what's weird with stuff like that? I have a similar experience when I was workaholic and training. Like the 90s to me, people make references about things that were happening then. It's like I was dead or something.
It's
wild.
It's
wild. They go, you didn't see that movie? I'm like,
yes!
I don't even know what you're talking about.
That's me. We saw Twilight for the first time last year, and everyone's like, Twilight came out just tonight. I'm like, I missed Justin Bieber, Twilight, like all that stuff. I like don't know. Like I'm just like I have no idea. It was so weird to blur. And your talk show, because I really did follow you all the time, so I was like, that's so weird. But when we had Donny Osmond on the podcast, he said the same thing. He said kids know him from like Masked Singer, but of course like old people know him from Donny Marie.
I had a little kid thing when I did the Masked Singer.
Yeah. Wait, you did the Masked Singer?
Yeah.
Oh my God.
I was on well, here's something more you don't know about me.
That's so weird. Yes, tell me.
This gets weird when I think about it. So when I was in college, I had about a year where I was like, I don't want to be a doctor. I want to do this. I'm going to do that. And one of the things I did was I trained in music. And I kept that music training going and became pretty good opera singer.
What?
Yeah.
Oh.
And so now my voice is all gone and stuff. But I was thinking about doing it. I was like, I'm gonna go to West Germany and I'm gonna do this. And
Wow.
wisely, I did not. There's the fantasies of youth. But when Masked Singer came along, I just said, guys, I should be on that. There's no reason to be on that.
No way. Did you ask like your people? You're like, I want to be on that show.
I said, why didn't you put me on that show? I sing. This is
Wait,
insane.
who were you? What's your
The
character?
Eagle. You can find the picture.
I need to look. Yes. Oh my gosh.
It was season 2. Everyone thought I was going to go pretty far, but I got to
What
my
happened?
second. Well, it was structured differently then. You had a sing off, and they had me with Patti LaBelle. It turned out, and I was like, well,
Oh yeah.
So-
Wait, what? You had to like compete against each other, and whoever was worse got kicked off.
whoever they would sort of vote. There it is. That's the
Oh
Eagle.
my God. Who knew? Every cool person is on The Masked Singer. We had Donnie, and now
You
we have
should be on
you.
The Masked Singer.
I would love. Nobody wants me on TV, but I'm always trying.
Why don't they?
Yeah, I
that's
don't know.
to their mistake.
I agree. That's why we just created this. I'm like,
right. This is the
Yeah.
future. They need to
I
interface
would love
with the
to.
future.
If they ever ask you again for a co-host, just say Trish. If you're on a TV show, if they want to do a Love Line reboot, MTV needs the help. You know what I mean?
Oh, I
We'll
have
be
an
on it.
idea for you. So hold.
Yeah.
So
Okay.
in late this stage of my life, I've thought, well, I should be like, I've had a lot of experience,
Yeah.
and I should use it to try to produce stuff. And I just had an idea
Yeah.
for you.
Can you tell me? Or not now.
Not now.
It's too
but
good.
It's not that it's too good. It's I want to get your honest appraisal.
Okay.
And then I got to pitch it. So
I love TV. It is kind of like you said, a little bit of a thing of the past, but because I am like a millennial, like TV is like everything.
TV, when there's television is still in people's homes. We still have a ritualistic behavior around it where we sit down and do the thing, even if we go to a major streaming platform. And it in success, it is extremely powerful. It's still a very powerful medium.
But like, don't you think like Mr. Beast gets like 100 million views, and like what TV show does that?
Absolutely. But
Yeah.
I'm not saying it almost can't compete with stuff like
Right.
that. But it's still culturally, if you can find have a program that people really attach to, it's still a very powerful distribution system.
I think the production of it all too is so cool, right? You go to a TV show and you're like, this is so big and epic, and
Right. So that's both its strength and its weakness. The people that
Right.
are there are really serious professionals. They really know what they're doing, and they really know how to create a production. We live in this world where I do it out of my kid's playroom, right?
Do you
And-
really?
Yeah, yeah.
That's so funny.
And it's so astonishing to me. And my wife is the producer, and it's just this
Yeah.
fantastic thing that you could reach the world. And at the time we started, it was just because had nothing else to do. Caleb Nation, who used to be a YouTube star, if you remember,
Yes.
is now
Love
my
him.
tech and producer. And he and my wife run the whole thing, and they convinced me to do the streaming show. And when I started doing it, I was like, God, I feel like the French underground. You know,
Yeah,
I feel
right.
I feel like I'm from this little room. I'm going to give you information about COVID that's illicit. And you're not supposed to know it, but I'll try to deliver the information.
Yeah.
Yeah, and
It's funny.
So those are the different. I think I fully answered your questions about the different
Yeah.
things I see.
Yes.
But it's interesting to see these trends come and go now. I've been through enough of these waves of popularity and being forgotten.
No, I mean you're like a staple, and everyone who comes on here is like, I love Dr. Drew. I need to talk to him.
Which I love doing. I mean, I love sharing. So let's do it. Let's talk about you and parenting.
Yes. Well, so this pregnancy, I'm just more emotional than ever. The first pregnancy, I was like fine, chilling, meditating every day. This pregnancy, I'm crying like literally for everything and anything. Like we did like once a month date nights, and we were at Mastro's, and we always
Once
go
a
there.
month?
Once a month. Is that a lot or not enough?
More, dude. More.
No, wait, what? That seems like that's a lot to just
Well,
get
with
us
kids,
out.
with 2 kids, it's going to be a lot. But
Yeah.
I always try to get people to do once a week if they can.
Once a week?
It's
Oh my
hard.
gosh.
It's going to be extra, when you're working and stuff. It's extra super hard. I
Yeah,
get it.
we
But
do-
thank you for at least adhering to once a month.
Once a month we're
And
lucky
that's
if we
good
get
enough for
that.
you. By the way, women have much more a sense of attunement to intimacy needs of a relationship.
Yeah.
And if that's good for you, good.
Yeah, I
Because
actually-
we're dumb. We're not dumb, stupid. We're just
Oh, for sure.
we're
that
just not great.
Our
That's
first Valentine's Day, I'm like, is there a card? Is there flowers? He's like, wait, what? I'm supposed to do this? I was like, wait, have you never had a Valentine's Day before? And he had no idea. So he like went out that day. He's like building me something. He's just like, I didn't know
You
we were
have
supposed
to
to do
teach
it.
us.
Yeah.
I'm not kidding.
No, he's
It took
great.
me quite a while, and the whole idea of flowers is like so wasteful to us. Like what?
Yeah.
Why?
Right. They just get thrown out. That's very that. But no, for our anniversary, even like in December, I was like just so tired. And he's like, do you want, like he made reservations. And I was just like, I just want to stay in, like sometimes
Hey,
it's better.
that makes us happy. We're doing this all for you, not for us.
Well, we did our
But
date
we
night.
derive benefits. We get the,
Yeah.
we understand that things are better when we do this. We just don't necessarily instinctively do
Well,
it.
especially when you have kids. I feel like before kids, I actually didn't care. And now it's like we never see each other. So I always tell him, I was like, I really miss you. Like,
Good.
It's
That's
like really
a great thing.
Yeah, it's actually
So
it's
good for you.
It's just like, it is a weird thing, right? You see each other every day, but it's just like, you don't get to see each other like you did. I kind of mourned like what we had before. I was kind of like, man, I really took for granted when it was just like us two.
Are
What
you
I mean?
still in therapy?
I haven't this one, and I feel like maybe that's why I'm a mess because I have not done therapy at all since I've gotten pregnant.
Maybe that's it. But you're. I just watch you evolve. You continue to get more and more evolved in terms of your emotional life.
Well, I can I feel like I can like regulate things better and stuff like that.
You regulate. You're also clearly better in sort of intimacy and attunement and things like that. And you said you mourn something. Now that's a high order thing to be able to mourn sort of. Mourn without grief, you know what I mean? In other words, you're mourning something legitimate. You've lost a little something here. You should feel a little like you miss it. That's a good, healthy reaction.
Yeah.
And you're letting yourself feel that. That's amazing.
But then you kind of feel like guilty, right? Because you're like, okay, well, our life is better because we have a baby. But then I'm just like,
well, it's not. These things are not all one thing. They're conflicted feelings. I get it. But I think when I first met you, I don't think you could have felt that morning. I don't think so.
Definitely
It
not.
would have set you off.
Yeah, it's like, and it's just one of those things. And I just recognize what he does and everything. But it is hard. So we were at.
Oh, I'm so proud of you.
Thank you. Thank you. Yeah, I try, but we were at our date night and I just like literally just started like sobbing and I was just like, I'm just so sad. And I like couldn't figure out why because like everything was perfect. We just found out we were pregnant and we didn't think like we'd
was
get
that the
pregnant.
beginning of the pregnancy?
It was like 3 months, 4 months in.
So still plenty of progesterone flying around. And progesterone makes
What is that? You said that before earlier, progesterone.
It's what the placenta is producing. It's producing a lot of it.
It's a hormone or what?
Yeah, a hormone. And it's causes women react to it very different. Everyone reacts differently. And even you're finding at different times you can react differently.
But it's kind of been consistent. Like I've been like, sometimes I just have these cries when we were like on Christmas break and stuff. I just was like crying every day. I was just like so sad. And I would just like find myself like driving my car to go somewhere because I'm like, I'm so sad. I don't know what to do.
So you have to be really careful because that during pregnancy depression increases the risk of the postpartum depression. Did you have postpartum last time?
I didn't think so, but like looking back, I definitely did, and I should have seen somebody.
Okay, and so that increases the risk this time too. That haven't had that, and it's highly treatable. So treatable. It's one of the most treatable conditions. So
How do you treat it?
It's medication because it's so biological.
Because last time you were talking to me about that, but I didn't think it was like something you could like take a pill for.
Oh yeah. 100%.
And it's been around for a while?
I would say that the treatment of it has been vastly improved since, say, when I was running at a psychiatric hospital. And there's just two things that can happen after pregnancy, right? You can get postpartum psychosis, which is the one where women put their kids in the bathroom and kill them and stuff. The psychoses are profound. Or the depressions, which are also profound, and they're strictly biological. They're 100% biological. I mean, obviously, with everything in neurobiology, there could be some psychological elements in there, but this is a biological process. And it has a biological solution, and we're very good at treating that now. I mean, very good. So don't not access that if you need it.
Yeah, I know a lot of the people that watch, they like related to this too, is like, you're scared to tell, when you go for your checkup for, after you give birth, they ask you like, are you okay? But you don't want to check no, because last time I checked, no, I wasn't okay. I wound up in like a mental hospital. You know what I mean? So it's like one of those scary things to be like, I'm not really doing great. What are they going to do with that information?
Let's kind of parse that apart a little bit. So you're fearful somebody's going to put you in inpatient, right?
Yeah, like what if you say the wrong thing? Like
right. So the wrong thing. Everything keeps people out of the hospital. They will. You have to be extremely in trouble for them to put you in a hospital these days. Okay, so I'm going to hurt myself, and I have a plan, and I have nowhere to live and nowhere to eat. Other than that, or I'm going to kill somebody. Yeah. Other than that, you're fine.
Okay.
You can say I can't function. I can't get out of bed. I'm really sad. I feel guilty. I'm worthless. Blah 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 blah.
Yeah.
That's all. No problem. We can treat that.
Okay, because that's what I know. So many other people are like, I'm kind of scared to like put anything because it's like. You just don't know what's going to happen.
Well, hey, listen, it doesn't have to be, another way to deal with this is that's your obstetrician doing that, right? The OB doctor?
Yeah.
Yeah. Just tell them, I think I need to talk to a psychiatrist. Don't even tell them anything, except I just want to get an assessment. Psychiatrists are so used to dealing with this, and they're so good at it, it won't be any kind of like funny business. OB, they get nervous because it's not their field.
Right.
So just if you feel like you need help, just ask. Look, I've been thinking about this a lot lately, which is that we live in a time where people are not getting treatment for brain conditions, right? Biological conditions, because of a bias that was created around psychiatric care from first like medieval times, where if you're possessed or there's something wrong with your brain, there's something wrong with you. Then more recently, I don't know if you're aware of this history, in like the 1960s, there was an author named Ken Kesey, wrote a book called One Flew Over the Cuckoo's Nest. Then there was a movie. That movie affected people like they were watching a documentary. They were not watching a documentary. They were watching a fictionalized hospital from the 50s. So literally, people are still biased from a story that was 75, coming in on 100 years ago.
No accuracy to it.
No relationship to medical care of the current
I haven't seen
age.
it. It sounds triggering.
It would be.
Yeah.
But it's actually a really good film. But that's not done like that anymore. It's all medicine. It's just anything that if you went for your appendix, it'd be different than in 1930. It's you know what I mean? It's not how it's done. And by the way, probably one of the fields that advanced the most in that 75 years is psychiatry. And environments where people get treated are usually lovely. So even psychiatric hospitals are not like that.
Yeah, psychiatric hospitals are like, I have trauma from them. So that's why I'm always like, I don't want to go back. And I honestly like don't remember ever saying I like wanted to hurt myself.
Well, when was it? How long ago?
2019. 3 times.
So 2019, this was 5 years ago. It's gotten better even since then.
Really?
So yeah, but they can. It depends where you go, right?
Alhambra was mine.
Oh yeah, we got yeah.
They wouldn't let me out.
yeah, there's a lot of cement there.
Yeah, just like walls, and they don't let you go to the cafeteria, and like it's like really crazy. You like can't leave at all.
And also the hospital, really the liability that I find. There's some nice areas in that hospital. There's some common spaces.
I was just in down one brick hallway. That was the only one.
By the way, I worked there too for a long time.
You did?
I worked all these places.
There was like an ED unit right next to it, and then there was like us, like one hallway, and it was co-ed, so it was just like boys and girls, which was like
with the nursing station right in the middle there.
Yes.
Yeah. That's it's okay. I mean, it's nice, but now these days the big liability of the big unpleasant part of these facilities is the people that do get in are so sick. And so low functioning that it's kind of uncomfortable to be around people.
I think that's what it was. And I was like, as soon as I was like kind of like sobered up, I kind of was like, I want to be out of here. And they were just very much like, no.
Do you have a relationship with that psychiatrist anymore?
No.
So you have a psychologist now, right?
Yes. And they gave us pills in that place. And like no one really evaluated me to like give me pills. And they made you take them at like 5:30 in the morning. Which
I know how it works.
I was like, what is this? What am I putting in?
I worked there for a long time. I know how it works.
What is it? Is it like a sedative or something? Like, because I know they gave me a sedative when I went there. They like stuck something in my thigh to strap me down. And then when I got there, they kept giving me like pills in the morning.
That was probably Ativan that they put in.
Ativan, that's what it was.
Yeah. And
no one asked.
Not an emergency. It's considered an emergency.
I just was running. I wasn't like attacking anybody.
I'm on your side.
I was just running.
To me, the odd thing is that they take a Trisha Paytas down, and yet somebody who's dying in the street, they won't go near. It's like
that is crazy, right?
That is crazy.
Yeah, that's wild to me. Yeah. So I have a little issues. I mean, it probably helps a lot of people, but not me.
But you are seeing a psychologist, right?
Not.
But you have a psychologist.
Yes.
So that's a person you can turn to help you assess whether you need or not need, and they would have somebody to refer.
But like postpartum, he's a gay guy. I don't think like postpartum he's gonna like. Maybe he knows. I don't know.
He'd be fine.
Really? I don't know. I feel like you should see a specialist because, like,
you will, but he would be able to assess your need for that and then who you should talk to. So you want to be somebody you can really trust because you don't want to go through all that again. But
one thing I learned postpartum last time, I think you talked about this last time you were here. Yeah. I was very anti-men, and I was like. After my birth, I was just anti-men, gay men, straight men, any men, because I just felt like they didn't understand, like my hairstylist and stuff like that. They just would like not understand like what I was going through. I'd have like a complete like breakdown during our Christmas card photo shoot, and they took it like personally. And so I was just like, men don't get it. So I was kind of like, that's kind of when I like distanced myself a little bit from my therapist because I was just like, you don't get me, you know what I mean? So I think going back would just be hard.
What about seeing a female therapist?
I guess just finding the right one. I guess
it's hard.
Yeah,
it's hard.
It's hard to find somebody.
But your statement that men don't get it could not be more accurate.
Okay, so I'm not like delusional.
No, as usual, your stuff is intense, but has a foundation in truth.
Yeah.
Right?
Right.
I mean, that's what we've always talked about.
Yeah.
You just have trouble expressing it or finding how to tell other people about it and stuff. But as we are very, very different as males. We just are.
But you get it. You're the only one that gets it.
I'm not the only one. I had to have years of therapy. I think I've told you that, right?
Yes.
And I get it because I had a female therapist who attuned to me deeply. And when you're the object of that attunement for long periods of time, you start to, first of all, understand what's happening. You start to get the attuned, which is really important for babies, by the way, which I think you're getting. I'm seeing that you're getting a lot better at.
Yeah. Mm-hmm.
You know what I'm talking about? Attunement, like be able to hang in with emotions and be present. It's hard with babies. They challenge all that.
I know. That's been difficult for me for sure. And that's why I always talk about like not feeling naturally maternal because it's like hard for me to like tune into that. And when she
is that because it's evocative or spins you at all? Or
spins me. Yeah, that's
which is normal. I mean, everybody gets babies. That's how they get their way. They spin you.
Yeah, I'm almost like I don't know what to do, and just
right. Well, try to take a beat and listen because you do have good instincts. You just have to hear them.
Yeah.
Right?
Yeah.
Can you help her do that? Because she needs support to be able to do that.
He does. Yeah. He's so great with it. Like I never once cry in front of her, like lose my cool, like nothing. You know, I can like remove myself because he's always here. But I feel for the moms that don't always have like a partner with them because if I was like alone doing this, oh my God, I'd be like.
Yeah. So I was object of that kind of attunement. I started realizing, oh my goodness, I've changed how I relate to my patients and my boundaries are better and I can really. I was such a codependent. I have trouble distinguishing between somebody else's feelings and mine, which is a hard thing. You get that?
Yeah, of course. I'm so codependent.
Yeah. And so what I thought were my feelings being evoked by the other person were really just the other person's feelings.
Oh, interesting.
And so that's what can happen. And your stuff can definitely go into that zone pretty easily. So you have to kind of learn how to keep that boundary straight. And it's a very rich place to live where you can feel other people's feelings and know that they're theirs. So codependency has not just liability, also has assets because you're attuned. You're in with other. I mean, you're like me in that you go out and then in, right? You experience other people, then you experience yourself. Mm-hmm. Some people are wired the other way, where they experience themselves and then they go reach out to. I know it seems odd.
What is that? That's like. Projecting or something?
Well, no. You can. Our type can also project. But Bob Forrest, one that told me that, he goes, I think there's two kind of people in the world: people that go in and then out, and people that go out and then in. I thought, I think you're right, Bob. You definitely go in and then out, Bob. And he goes,
we love him. Where's he at? We need him on the podcast.
You get him a second.
Is he around?
Oh yeah.
I love
my
him.
goodness,
okay.
he's very. Both he and Shelley have had long careers, and Shelley is like, you stuck to her.
Yeah, I loved her on the show too because they did the house after, right? They did Sober House.
Yes, they did all that. But Shelley now was run program. She got another degree. She's like amazing.
Oh my gosh,
amazing.
So
she was a bad heroin addict. Oh my God.
Really? Heroin's so intense. When you said both of them did heroin, I'm like, that's so intense.
It is intense, but
oh my gosh, like that's like you have to like wrap it up and shoot it out. It's like so much.
It's so much.
Wow.
And now fentanyl is what they're going for, and fentanyl's killing everybody in good times.
Yeah.
And now everybody's fentanyl meth, which is a terrible combo.
But fentanyl's in everything now, right? I'd be scared to do drugs anymore because it's like literally in everything.
Your audience would be good to be warned about this. So let me make a warning.
Yes, please.
Which is that every time you buy something that you don't know where it came from or you didn't get a prescription for it didn't come from a pharmacy, literally every time, no matter what the substance is, it could be laced with fentanyl and it could be laced with enough to kill you with a single dose. It's happening a lot. That's the growth. I think everyone's aware that people are accidentally overdosing on fentanyl, that they seek, that you're going to get fentanyl, or the fentanyl gets mixed in with the heroin and you don't judge the dose properly. Accident. But the group that is accelerating most rapidly in terms of numbers of deaths, it's young people just screwing around with meds. And they just get their hands on something, they think it's a Xanax, dead.
Xanax too?
It's in the Xanax. It's in everything.
Wait, what? Really?
It's in Xanax. It's in cocaine. It's in cannabis. It's in everything.
Whoa. Yeah. Oh my God, I did not know that. I always thought it was like Coke or something like it was.
It's in everything. They're putting it in everything to, I don't know what. I don't know what they think they're doing. I guess give them more high, get them more hooked or whatever.
Is it cheaper or something? Is that why they're doing it? They're making
it must be cheaper, for sure cheaper, and somehow more satisfying, I guess. Or they think it's going to be more satisfying.
Where does
they
it
put
come
just
from?
a little bit more fentanyl.
Yeah.
It is purely synthetic. So heroin comes from poppy. Fentanyl is made from essentially things in your garage.
Oh my
And
God.
that's what's happening right now. They're making these. They can't keep up with it because they figured out how to. And they've even in the meth too. The meth is like incredibly toxic, and the way they make it is.
Well,
just
those are all
awful.
like scary drugs, right? But like people who just do like Xanax casually, like that's like a whole different thing. That
I don't want to encourage anybody to do Xanax, but if you get Xanax from your doctor, you pick it up at the pharmacy, that's going to be Xanax.
Yeah.
But if you go on some Snapchat or something,
Yeah.
that's going to be fentanyl.
they do sell it on Snapchat.
Oh, that's where
crazy.
all the kids locally here that I've seen that have died got it on
Oh
Snapchat.
my gosh, that's
I
actually
haven't seen a
something.
lot of these cases, but I've seen enough to deeply disturb me.
Yeah, we just hear about it too. You just hear about all these deaths, and you're just like,
Well, nationwide, I know it's going up and going up fast because wherever I go, I encounter the parents who go, "This is the topic. You need to talk about this
Yeah.
because it's happening a lot, and it is happening a lot."
and they're not doing anything to like stop this, to regulate it.
What do you
They
do?
can't.
I mean, it's so hard. It's
It's like drugs, like heroin. It's just like
I think all you can really do is educate the young people. Like, don't do that. If you have to do drugs, I mean, don't just get it from anywhere.
But that's what I was wondering too. So you were talking about like educating people during like the AIDS pandemic and stuff like that. So what did you tell them then? It's like now you just said don't do drugs. Back then you're like just don't have sex or what?
No, I didn't say that because I knew how unrealistic that was.
Right.
I was all about use a condom. I was one of the first people to say that. And the term safe sex, the term hadn't been coined yet. That came about 3 years later. I was just like, look, you can reduce your risk significantly by wearing a condom. So wear a condom.
They weren't talking about safe sex before that.
The term hadn't been invented yet.
Oh, what? That's
I remember the article where they invented it. Yeah.
wait, what? That's so
Yeah.
weird. So people were just like in the 70s, like willy nilly.
Well, they would use condoms for birth control, but they would never think of it for STI or
got it.
STD. And at the time, the young culture was freaked out in 1982 and 83 about herpes. Freaked out. Like, oh my God, herpes.
my
and,
God.
and I came in and said, yes, you don't want that, but that's a skin rash. This is a fatal illness. Please understand the difference.
Oh my
And by
gosh.
the way, you can reduce the risk of both. Put on the damn condom.
Wow.
And at first, what I got a lot of, they knew they were at risk for herpes, but they didn't really think they were at risk for HIV and AIDS. We didn't have, we were calling it GRIDS the year before, gay-related intestinal disease syndrome.
Wow.
And in 84, we started calling the causative agent HTLV3. That's what it was called.
What is that for?
Human T lymphotropic virus.
something
Because
complicated,
we knew it was affecting the T cell lymphocytes.
Oh.
And the HIV came later because it kind of combined a few of the different genetics we were saying there.
And now they have PrEP, so get on PrEP.
I know. And do you know
I
this is
advocate for it all the time. Like go on
PrEP
PrEP.
and the post one too. You can get pre and post.
Oh, I didn't know.
So this is I realized that I've not been doing my job lately because of exactly this.
Yeah.
Because so PrEP, of course, is you take these antiviral medicines
Mm-hmm.
to reduce your risk dramatically of getting HIV and AIDS. There's one you can take post-exposure. It's a little bit longer, a little more complicated. But if you, say, shared a needle or something, is where we see it most often, you can get this post-exposure prophylaxis, PEP. So there's PrEP and PEP.
Okay.
And you can get post-exposure prophylaxis for almost all STDs by taking a doxycycline afterwards.
What's a doxycycline?
It's a tetracycline. You just take a couple doses of doxycycline, and you're like 90% reduced risk of HIV. And the
After
fact that,
exposure.
excuse me, not HIV, all the other bacterial STIs like gonorrhea and chlamydia and all that, you can dramatically reduce the risk by taking an antibiotic
After exposure.
after contact, even if you don't even know. Why not just take it to be? It's tetracycline. The things that we have people take for years at a time for rosacea and things.
Oh.
It's just a
I didn't
common
know.
medication.
That
Yeah.
you can just go get at your like doctor's office or something.
Well, a brief ad for a company I work for called the Wellness Company, TWC. We put together these emergency kits. I didn't know I was going to talk about this, so apologies. But TWC, you can get it doctor.com/TWC, where you get a telehealth visit, and we give you these emergency kits.
That's
and
amazing.
I'm going to start having STI kits on my website, so you can just get it and reduce your risk. You can get some, if you want some Valtrex to reduce your risk for herpes or for transmission of herpes. If you need we live in a time, Trisha, look, I think we live in a time when the physician has been so adulterated and the physician-patient relationship has been so intruded upon that I started thinking, I think we just got to get stuff right to the patients because people are not dumb. They've heard of these things a million times. They get how to use these things. We'll give them a telehealth visit. We'll give them a guidebook. Let's get this stuff to the patients.
Yeah, it's also like a lot of people are just embarrassed or they don't want to admit it or they don't want to
Another way, I
ask.
don't even think about that. I'm just worried about getting patients back in control of their health care.
Yeah.
For not for not a lot of money.
Yeah, but so many guys, when I'd get like chlamydia and I'd tell them and they're just like, oh, get me a pill too. It's like not that easy because you have to like take one pill for yourself.
We're thinking about that. Yeah, we're thinking about that. We're trying to decide how to give the partner stuff too if they want it.
Because it's also, they don't want to go in because they're just like, I don't know, embarrassed or stupid or whatever. And it's just like, well, they only give you one pill at a time. When I was going to Planned Parenthood back in the day, and so I get one pill. I'm like, I can't give you this. But then what happens? You go back to hooking up with that person, then you get it again because they didn't take care of it, and it's just a mess. And it's the worst.
It is a mess. But I like that you're somewhat matter of fact about it because back when I was talking about it in the '80s, people wouldn't even. They'd be like, I haven't. They'd be all free. Like there was a moral blush to all of it.
Right.
And that was just so dumb.
I still feel like there is a little bit, but maybe people are being more open about it like a lot of people get.
They're just more realistic. I wish people could talk about the brain stuff just as easily as they do now, the STI and STD stuff.
I think it'll get there. I think the more people talk about their diagnosis and stuff like that. Like if Charlie Sheen talked about HIV, it'd be like a more like impactful thing, right?
Yes.
Like people would be like, it's common, it's this,
It's exactly why we did Celebrity Rehab, just to sort of people that wanted to share their stories, and they did, and they helped a lot of people as a result.
Yeah, like they're like, maybe I should like get some help because it sounds like me, you know what I mean?
I saw that so much in the aftermath of Celebrity Rehab. In fact, we started calling it the Wizard of Oz moment because people they'd come in, they're messed up, and they'd go, I watched this show, and so I couldn't deny it anymore. That was me. And they'd look up and they go, and you were there? And you were there? And you were there.
They're like, this is, No, it was a sign. Mine was more the second one you did. I think it was the SLA one. Where they were like
sex and love addicts?
Was it sex rehab? Was it
we called it sex rehab. We called it sex rehab.
Yeah, that was the one where I was like, and I was very young, but like I related to like the sex love, all that. And then later on I ended up going to SLA and stuff, and I was just like, oh, that's actually something that like I did have, which I didn't know.
So happy.
I remember I was like, this is interesting. This is a different kind of addict. Because like the heroin ones I couldn't relate to back then. And the SLA ones I was like, okay.
Oh my God, that's so awesome.
Yeah.
And do you remember Jenny Ketchum, the porn star, Penny Flynn?
Yes.
She is now a medical social worker with her own practice and 2 kids, married, different person.
That's amazing. And you keep in touch with her?
All the time. She's an inspiration.
I love that. Yeah.
She would come on and talk to you.
I would love it. I'm like down to talk to anyone. You know what I mean? Especially with that kind of stuff, when people are open about it.
I should get she and Bob involved with it.
I would love that. Yeah. I because so many people don't want to come out and talk about it. Even people I went to like mental hospitals with, like that had, there was someone I was with who her husband was a soap opera star. He, I guess killed himself, and then her son also did inside of a mental hospital. Mm-hmm. So she was in there when I met her, and she like was so vocal about it, but she doesn't talk about it as much anymore. And I just like wish more people would.
She talks about, I know who you're talking about. She talks about her alcoholism. At least she had been until recently.
So yeah, I haven't, because we were together in the mental hospital. Like I met her, and I remember looking at her and thinking like, oh, this person looks normal, right? Everyone else was like been in there for a while, and I was like, oh, this is like a pretty girl, and stuff like that. And she was very open about it, and I've been trying to like get in touch with her because I just feel like when people talk, like when I talk about my stories, so many other people are like, I too went to a mental hospital, and it becomes like normal. It becomes like an okay thing. You don't have to feel like ashamed about it.
It shouldn't be different than I went into a
physical hospital.
Yeah. In fact, I don't like that we separate them even. I mean, they have the nursing's kind of specialized and stuff, but they should be as brought close together as possible. Because the more you make it other, the more you add to the stigma and stuff.
Well, that's when going back to the fentanyl thing. So I was asking you about that. By the way, the PrEP stuff, everyone I know that was been on PrEP never got COVID. Do you think it's any correlation?
That's interesting.
They never did.
Thank you for bringing that up. I'll look into it.
Yeah, I was like, that
makes sense to me.
Because when you were talking about just now that it's like such a strong like drug, like for like rosacea was also used for like STD. I'm like, maybe there's like something to that because they never got it, and they were always like out and about and stuff, and they never had. And then I think like 3 or 4 people I know that were on PrEP never had COVID ever.
Fantastic.
And I was like, wow. And they're always out and about, and they're doing stuff. And
well, the whole world of viral treatment needs to be systematized better. We have all these early treatment ideas. We have all these protease inhibitors, and we really don't know. Like, we should be able to treat just bad flus much more systematically.
Yeah.
Because we have great things we could use.
Yeah.
Like there is some data recently, there's all this BS about the avian flu, bird flu's coming, coming.
Oh, no, I don't. I get so scared of it. Moses
bird
knows
flu's
this stuff.
coming. You heard this stuff?
Something's coming.
It's all bull.
Okay. I get scared. I'm the one that gets fear. I'm like,
Okay,
oh.
well, let me contextualize it for you.
Okay.
It's passed in some animals. One case has been documented in a human being. 0 cases of human-to-human transmission. So in my thinking, if there's a sudden development of human-to-human transmission, then they're messing with that virus somewhere in some biology lab. You know what I'm saying?
Like it's man-created.
If it suddenly goes to human, that to me is evidence that it's man. That's too fast. So you can protect yourself by keeping some Tamiflu around, because even if it's human to human, it responds to Tamiflu.
What's Tamiflu?
Tamiflu is it's originally designed for influenza, and it has some benefit. Now it's antiviral activity. Again.
I feel like Valtrex might be like right up there too, because that's such like a strong anti.
It is. Valtrex is funny though. It seems to only work on the herpes viruses. I've not seen it really used anywhere else. But I'm interested in this. I'm gonna start looking at this stuff.
Yeah, I don't know. I'm not a doctor.
Well,
but
you piqued my interest with the PrEP stuff. That's interesting.
So with the fentanyl now, are you just saying just don't do drugs, basically?
Well, no, that's not realistic. That's not realistic. I'm saying don't buy drugs from illicit sources, and don't think because it's a pill and it looks like a Xanax that you're safe. That's all I'm saying. Please, everything. Just assume, and you can buy kits to test it. Now, the problem with the kits, they're great, by the way. The problem with the kits is you have to test every pill. And it's hard to do that.
Yeah, and like when you want to get high, you're not really like, let me test this
first.
Should.
Yeah, people are into drugs. Are not necessarily into test kits.
The drugs scare me for sure. Like again, now I'm doing C-section and all the stuff. Like, and I just get so scared to get, because they give you fentanyl when you do the C-section, and I was so out of it for like the 4 days. Like I don't even remember my baby being born. Like I don't remember anything those first 4 days.
Yeah.
But it's like, there's no alternative. And then
yes, there is. Fentanyl is it's a common one they use. So more about my stuff. I have something called Lynch syndrome, which is a DNA repair abnormality. So it put me at risk for certain cancers. So I have to get colonoscopies every year.
We were just talking. What is a colonoscopy? We were just talking about that.
It's a 9-foot scope. You clean your guts out completely, and then this 9-foot fiber optic cable goes up all the way through your colon, and the doctor examines every inch of your colon.
What is it? Where's your colon go? How far deep is it?
It goes from
the butt.
Your through the sigmoid colon, all the way around it, all over here where your appendix,
they're putting
where your appendix is.
A tube up there?
A big long tube. You're asleep.
No. You're out of it. Okay. Yeah. Okay. I thought it was like that you're awake. I was like,
no,
that's not bad.
I've actually done it once, semi-awake, but I don't recommend it.
Does it hurt after?
I did it just because I wanted to film it and talk about it and stuff, but because I have them all the time. But
doing it for the plot.
Well, just to get people not to be worried about it. But because people are weird, they don't do their screening.
Nobody wants to do it. We just talked about it. No one knew what it was, and I'm like, it sounds terrifying.
No. At 50, unless you have family history or Lynch syndrome, something like I've got, 50, age 50, every 5-7 years. But they used to give me fentanyl for that, and I would have. Usually do my tests on Friday, and I would be destroyed the whole weekend.
They give you fentanyl for that? Wow.
Yeah. I made them not do that anymore. I have no fentanyl. Allergic. I get headaches. I feel like shit.
Oh.
So I use something called propofol. That's Michael Jackson's milk.
Oh, is that how he died? Mm-hmm. Oh gosh.
And so you have to have an anesthesiologist and all that kind of stuff.
Is it stronger than fentanyl?
It just puts you out. You're just poof. You're gone.
But you can't have that during a C-section, right? You can't be out.
I don't know how to answer that because the answer is not no. Although you have to worry about the baby's respiratory system too and stuff. So, didn't you just get a spinal tap, spinal anesthesia,
like an epidural?
Epidural, yeah.
I did. I was in so much pain. I don't even remember that. But that was for pushing. And then after pushing, they're like, well, we're going to give you more something
stuff.
More.
There's a lot of different opiates to choose from. Fentanyl is not the only one. Just tell me you think fentanyl is affecting you badly.
Yeah, because then afterwards when I came back, they tried to give me opioids, and I was just like so scared to be addicted. So I just was like, I'm just like feel out this pain or something.
Did you ever have
like
a period
that.
where you got strung out on this stuff, or?
Yeah, I did. Oh, for sure, with painkillers, like that was like we talked about this before, where I thought it was like an addiction, but maybe not addiction. It just was like a problem for sure.
You got dependent on it.
Yeah.
So yes, it could happen again. So you got to be very, very careful. And if you do need something, I mean, you don't want to suffer, right? But try to do very time limited supplies. You know what I mean? And you should be the one to administer it, which is a great source of conflict. But you should do. That's how it should go.
No, and he never knows either because he just doesn't know like how I feel. But I just remember like not knowing. I mean, don't get me wrong, it felt really good. I was just like, oh, woo, because I didn't remember any of it, and it was like, oh, I don't know, he was like, your guts are all this stuff, and I was like, I couldn't tell you anything that happened, but
how has motherhood been?
It's been great. The first 6 months was okay. This is something I talk about, and people judge me for it so much. But I feel like
people judge you for everything,
I
Trisha.
know.
So.
But I feel like a lot of people relate, and that's why I keep talking about it.
It's a weird thing that women do too. They love judging women and their children. And that's what Teen Mom was all about.
Oh my gosh, yeah, that's crazy. That show's still on. There's like all
crazy,
these
13 years.
Wild. All these kids are like adults now. It's like so insane. No, the first 6 months, it definitely was. What did I do? I was like, oh no, because like it is. And this is like something I like just want to talk about because it's like you have the baby, right? You don't know if you're going to be a good mom or not until the baby's here. Mm-hmm. So for me, I was like, I'm not a good mom because I just didn't connect. I didn't know what to do. I didn't want to do anything. I didn't find myself wanting to nurture, you know. I was like, she cries and I'm like, I locked myself in a bathroom, you know. And that was like that for the first 6 to 9 months, I would say. And it just was like terrifying because you're like, okay, I have this baby. I made this choice and now I'm like this bad mom, right? Like I don't want to be a mom, right? And so that was my experience.
I think that's depression.
And that's what so I didn't think I had postpartum. I'm like, I'm fine. Everything's fine, you know?
Yeah.
But I think now looking back, that's what it was because I was just like, I don't know. And then I got out of it and I felt like, you know, that 1 year mark, you're just kind of like, oh my gosh, I'm back to myself. Good. And it's
which,
like.
By the way, the postpartum depression is always within the first year.
See, I didn't think it would be that long.
Don't suffer like that. You suffer needlessly.
Well, but you just don't know it, right? You're just thinking, oh, well, maybe I'm not meant to be a mom. Maybe this was not, you know, whatever. Mm-hmm. So that was my, that was it. You know,
it can be associated, by the way, normally, not that the condition is you want if there's a condition, the depression, but it can be associated, that condition can be associated with fantasies of violence and hurting the baby and all kinds of crazy things.
Yeah, thank God I never had that because. Yeah. And that's, we talked so much because that was like one thing that like you hear about this stuff, which is so real, right? Like the what do you call it? Psychosis?
The psychosis part is different. That's where they're really, really wild. Yeah.
Yeah. And I was so happy. I had like so many moments where I was like, that was the ups and downs. I don't know if it's the borderline or just the postpartum of it all, but I was so happy a lot too. I would like look at her and just like start crying because I was like, oh my gosh, this is like such a love. This is like pure. Like she's so untouched by the world.
I think that's good, but I think that's more the borderline stuff. Because they called you bipolar at one time too, right?
I took like lithium and stuff. They had given me medication for it.
Because borderline and bipolar, the mood stuff can be very, very similar.
Yeah. So it was highs and lows for me because I would look at her and just be like, oh, I love this baby. Like she's so pure.
So when you talk to your psychologist, whoever you talk to, make sure they understand that history, that there's, you know, this mood instability and stuff.
I think that's where maybe I should have maybe sought someone that was more of a specialist because not that he wasn't like equipped, but I think it was more of like just doing the regular borderline exercises, right? Like breathing and stuff. And like it works, but like my mind was still like, I don't know, crying.
Something more is going on. Yeah. Which is you should take advantage of modern treatments.
Yeah.
But, you know, I want a sort of assuage of your guilt and anxiety about it because there's something in the object relation and psychoanalytic literature that's called the good enough mother. Mm-hmm. That's all you have to be is good enough. No perfect mother. Ain't one anywhere. Doesn't exist. Mm-hmm. You have to be good enough. And good enough usually means just making sure the baby's needs are met, being available more times than not. Yeah. And not traumatizing the baby. That's the key thing is not traumatizing.
Well, that was the big thing, right? I'm like, I don't want to ever have her see me cry. Obviously, we never argue. What is like the key things to not, because my biggest fear, right, especially when I found out I was having a girl, is that she's going to turn out like me, where it's like maybe intentionally or not, you know, my parents, maybe I had a little trauma, you know, because they were working too much. I never saw them.
Will transmit through you.
Yeah. So how do I not traumatize her with those feelings, right? It's like now we're at a good place, but it's like I never want her to be like, why is mom crying? She doesn't get it, right? I would cry and she would, you know, like she doesn't see me cry. So it's like
I think it's going to be a long process, right? Because kids feel responsible for everything. They feel like if something's happening in the world, it must be them. Mm-hmm. And so the key thing is to try to make sure there's no contagion involved, where if the child has a need, it isn't evoking stuff in you that's pushing the child away, that you're just present with the child's need. And if you need time away to regulate and whatever, you move away from it. Yeah. And it's just being good enough. It's not being perfect, and you can do it, no doubt in my mind. And then later, as time goes on, to keep educating about, you know, mood and what mood is and how you're not responsible for it. And it's just a thing in my brain that goes off once in a while. And it's hard for kids not to feel responsible for all of it. And just keep reinforcing you're there for her.
Yeah.
And that her responsibility is not you. her responsibility is to be a kid.
So your best advice then would just to be like, pull yourself out of the situation if it's like too much.
If you can. Again, I don't want to say it that glibly because these are complicated situations, all of them. But to make sure that you're stepping in when she needs to step out, I think and to have a little bit of a dance, and if the kid is mommy, 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 which is the other thing that nobody tells you, right? Is that nobody can substitute for mom for that baby. That is so astonishing to me when I see it. Like it's like the baby puts a hose into your soul and goes, "I need it. I want your soul." And it's literally the situation. And so it becomes about pacing yourself and not depleting yourself and listening to your own feelings and then attuning as best you can to the baby and getting those needs. The first year it's all pee, poo, food. Anyway.
Right. Looking back, you're like, oh man, that first year, you like not having a newborn, it doesn't stress us out. Like we haven't even prepared half of what we did for Malibu because we're like, they just sleep, for 3 months. It was like, looking back, I was like, man, those actually were like the easy months. Now she's like walking and throwing herself down, everything. She's just like being wild. And
wait for this next 2 years, a lot more of that
Don't say that. She's already so rambunctious. And I'm just like, oh my God, like just tracking her and following her and stuff has been, but yeah. And then once she get past that year mark and I'm just like, this time around, I'm going to try and enjoy the baby phase more because I just feel like I wasn't present.
Good.
And I feel like guilty about it. And I almost feel like in a way she felt that because instead of mommy, 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 she's very daddy, daddy, daddy.
Okay. Well,
and so then I'm kind of like, no, like
But she got her needs met. She's fine. And it is. Keep also in mind that a big part of what the parenting job is because we all make mistakes, repair. How do you repair your deficiencies, which we all have?
Yeah.
And somebody stepped in and helped repair it. That's all. It's okay.
But it breaks your heart.
Well, it breaks your heart. But your job, but you have to not let that be her responsibility.
No, I know. I am just like, I'm happy. I'm like always happy. I'm like, well, at least she has, super dad over there.
Exactly. But I understand that it would hurt.
Yeah. And I'm just like, with this next one, when we found out we were having another girl, it's just like, for me, being a girl was like so hard. And I'm like, I'm already so scared for them. I'm just like, like seeing her interact with kids and like they're pretty nice to her, right? But she's 1.5 and like 4-year-old girls don't want to play with a 1.5-year-old at the park. So she'll be there eating like her macaroons and like she might want to like play with their bubbles or something and they don't like want to play with her. And already I'm just like, play with her. Like she's saying hi to you. And it's like breaks my heart. And I just like those kind of things. I'm just like, I just want to like shelter her forever because I'm just like, I don't want her. She's going to get jaded. Everyone does, right? I know.
Well, you want her to be resilient.
Yeah.
Right. So not too much self-esteem building, right? You need to be assessing reality.
Yeah.
But enough self-esteem building and not too much sheltering. Not too much. You want to let her struggle. It's hard. What were you bullied a lot growing up?
Oh my God. Like actually a lot. When you look back at it, you didn't think you were. And bullying in the sense like they would just make fun of like your hair, call you fat, like all those things like that. And I talked to another one of my friends whose daughter's like 5 in ballet and she wears all these oversized clothes now because kids called her fat and she's like literally not. And it's just like, and that, I don't know, just having to deal with all that. I'm just like, man, I just feel girls have it a little rougher on that sense. And
it's other girls that are doing this, right? The boys are sort of busy with the dirt clods.
Yeah. I heard you on a podcast talking about like the girl on girl hate. Just recently on yours, I think it was on Ask Dr. Drew. You had, I think she was I don't know what she was, but she was talking about the hate that girls.
Yeah,
she was from China, so maybe it was
it was Zhao Ying Summers.
Yeah, and she was talking about how like it was like this competitive thing, and I was like, that was so interesting.
Yeah, that drives me. It's bothered me for as long as I've been aware of it, which is that women want empowerment. They want to do all these things. They want to be free. They want to, and be capable and competent. All these things that they're quite capable of. But then they attack each other.
I know.
So and they start really gets vicious around age 12, right? Like
it seems earlier now, like 10.
Now it feels like there's some sort of weird. I don't know what that is, but that seems like poor socialization, frankly. I mean, you should be getting kids to relate to all kids.
Yeah, I don't know what it is.
I don't know what that is. Maybe that was a group of kids that, I don't know.
I don't know. It seems to still be going strong. I thought this bullying was like over and I'm just like, how do you do it? For me, I'm just like, I just want to isolate her. I'm just like, I just want to like keep her away from all these kids in school. And I don't know. I'm
just thinking it was back to this sexual content. I was used to give these lectures where I would go to colleges and ask, why if random hookups are the founding principle of your social life, that's where also, that's what you're looking for every night. Why do you have to be so f***ed up to do it? Why do you have to be drunk? Why?
Mm-hmm.
Why?
Yeah.
And so I'd ask big room of kids, and men would raise their hand. I go, men first. Men, raise your hand. They go, well, I could get rejected, and it's a tall order, and it makes me really, really, really anxious, and I really want to do this. And so I just drink so I just, can deal with the whole situation. And eventually they will say something like, also, I don't want to hurt anybody. And I'm afraid I'm going to hurt because they know it's not good for everybody to just randomly
just casual hookups. Yeah. Well, that's good. They're aware of that.
Well, but they drink it away, right?
Yeah.
So that's why they're drinking. So I go, okay, ladies, you've heard the male point of view. Now, why are you? The room goes silent. They never. Then they go. So eventually somebody go, I could have beer goggles. And I go, okay, I get it. Men do wear beer goggles too. Women, we get that. And then the room goes silent again. And this is every room I was ever in. This very strange thing happens where I go, look, you just heard them. It's anxiety. That's all they're drinking for, and they really want to do this. And somewhere in the first third of the room, a girl raised her hand and goes, well, I do it to make sure I don't feel anything. And I
emotionally. Oh.
And I go, oh, well, that's different.
Oh,
that's not what they're talking about.
Yeah.
They're not having that kind of experience with this. And so you're telling me you as a woman are suppressing something fundamental in who you are with alcohol to deal with this thing that has been foisted on you that's not good for you.
Right.
Why are you doing that?
Yeah.
And then we ended up talking about, this is what got me into this thought, talk about women who are promiscuous or whatever. And I'll ask the men, do girls promiscuous that bother you? About 80% of the men are like, I don't care.
Wow, really?
They're like, I like one with history because I hope history will repeat itself.
Right. That's what I like.
Yeah. But inevitably, some women will, what the studies show is that women will go to those guys and go, just start talking about her.
Yeah.
And the women
always
will coerce the males into having a bias against the females.
Oh, especially in high school too, I feel, especially those were the ones that's like, oh, she's like a slut and whore.
Whatever that is needs to be addressed and stopped.
I wonder why. Oh, because the guys like those girls, so the girls are like, ew, but she did this, this, and this.
Exactly. So so think about what you're doing. You're harming other women because you're worried about the resource of the male. That's not okay.
My gosh.
It's terrible, right?
Yeah. And they feel something after, though, right? Like after you're like sober up and then you're like, oh, damn, what did I just do? You know what I mean? Don't they have the feelings after anyways?
They many of them will cop to that.
Yeah.
But in order to do this, they have to be drunk.
That's so interesting. Yeah, I was opposite. I was promiscuous. I was like, I want to feel that like dopamine of like love.
Yeah.
While you have sex. That's all I cared about.
So that's the SLA stuff, right?
Yeah.
Which is
yeah.
Which is your own burden.
Oh, man, it's like such a high, too, when you're like, get someone to say, I love you, and you just like met like 10 minutes ago or something like that, like in the moment. It just feels so good. So I didn't care about like the after part of it. I was just like, well, you just find someone else like an hour later,
So that's the addiction part, right?
Yeah.
So you go, okay, I want that again, that dopamine.
The addiction is real. And since we last talked, I feel like my spending has gotten so much better. We're like, have so much more savings.
Congratulations.
Now. Thank you. And even
everything seems better to me. I mean, your trajectory is a very positive direction.
Thank you. Yeah, overall, I do feel like better. You know what I mean? And I think, again, it was like when it was like that year mark for her. And I'm like, okay, I'm like myself again. I'm like working and all this stuff like that. But the addiction now is being pregnant, I think. Because we were talking about this, like it's a little harder this time around, but my, I guess disordered eating, not really eating disorder, is like controllable. Like I don't overeat because everything's so high and I feel full and it feels like, Ozempic. So I don't overeat. I really only eat like pretty healthy things. I mean, people online will see that I eat fast food for like once a month for like videos, but I eat pretty healthy in my day to day. I love to eat oatmeal. I like crave, stuff like that. And yeah, my emotions, while they're sad and stuff like that, I can like just like I regulate better. I can snap out of it. Masters, I'm crying and bawling, but I can like get it together and be like, okay, everything's like fine. Good. So I just feel I love being pregnant. I can rest and not feel guilty about it. And it's like now I'm worried about not being pregnant. You know what I mean? I'm just like, and you get attention. Oh my God, the attention you get when you're pregnant, especially 9 months, you go out with a belly, he'll be with me. And guys, girls, everybody, guys are just like, let me get the door. Oh my gosh, you're doing a wonderful thing. Like just praising you.
But you're going to get a different, but similar intensity of attention from the kids. As being a
that's
mom, moms get and deserve a lot of it. I mean,
Yeah.
you the respect for mom is appropriate.
Yeah, I guess.
And I think you'll see some of that come your way. But I'm hearing you mostly talk about the eating.
Yes.
And the word Ozempic came out of your mouth, I think. Did it
Yes.
not?
Did we talk about this last time? I'm so
don't
obsessed with the
remember.
Ozempic trend right now. I want to. We didn't talk
I
about
don't
it
think
last
we've
time?
talked about it yet.
Okay.
So do you want to do that?
I would love to because we talk about it every single hot topics every week. I'm obsessed with people being skinny and how skinny everyone is. And I'm like, I want to do it so bad. He's like so against it. My co-host has been trying like faux Ozempic. And so we're obsessed with the skinny for sure.
He's been trying faux Ozempic?
Yeah, it's like a knockoff version, I guess. That's like not as expensive that he gets from his
the
doctor.
other
Yeah.
GLP-1 inhibitor.
Yeah.
Well, it works. It does work. We don't fully know all the side effects yet. And certainly people have lots of side effects when they're using it, right? Nausea and all kinds of stuff. Feeling uncomfortable, tired. The dreaded complication is something called gastroparesis, which happens, we don't know what percentage yet because so many people are taking this medication, which is really a bad drug. Just constant abdominal pain and nausea if you get that side effect. It's just forever.
And people have gotten it from Ozempic.
Oh, yeah. It doesn't seem to be common, but it does happen. Okay. We don't know if there's going to be other things. I am a fan of it on a short, limited basis.
Oh, okay.
I really am all about health and fitness and diet and all that. That's my thing. But if somebody's done all the right things and still struggles, I have no problem with that.
Wow. Okay.
But I don't like this idea of going on it indefinitely and stuff. That really bothers me.
But I always heard too, if you like are not on it for life, you just like gain it back.
If you don't, you not only can you gain it back, you can go past where you were, and you're now at risk for the gastroparesis also. But so it's not a perfect solution. But if somebody feels like if I could just get this off, I could get into my health and fitness and whatever. Are you going to breastfeed?
No, I do not.
Okay. So it worries me in that first year of childhood because there's so many other biological changes going on.
Yes.
But after that year, if you wanted to look into that, and let's say you were my patient, I would go, look, you're a healthy young woman. Have you really done everything you can from a diet and fitness standpoint?
I feel like yes.
Then I would send you to somebody to talk.
I mean, I'm not like the cleanest eater, but I'm also not like a binger anymore. You know what I mean?
Yeah.
And it's just like,
What about the fitness part?
You know, for me, it's like weight loss, right? So we were going on walks and I was like losing weight and stuff like that. Cause I feel like if I go to the gym now, it's like, I don't want to like bulk up, but it's like the cardio of it. We were doing so good. I was doing good, but I wasn't, he loses it so quickly, like instantly it'll be down, but we go on these long walks. I mean, literally like 4 miles a day. And I would kind of be the same. I kind of would just like.
You might look into sort of HIIT cardio. Do you know what that is? Sort of these little intense bursts you can do on a treadmill.
I think I would die. I used to have someone that had me do that, and I was like, I will pass out.
You don't have to do it. You can do it only to me. It's a very remarkably effective. I need it for myself. I've discovered it only sort of recently. Dramatically changed my metabolism.
But you're a fit person. Like I don't even run, Dr. I can't run. I physically can't run.
You can't do it.
Like physically, like I actually don't know.
Bicycle.
I don't think so. I haven't ridden a bicycle in so long.
You ever been to Peloton or anything like that?
We do have a Peloton. I've never used it. It's in our
Maybe
garage.
we get her on that, or even just on an intermittent HIIT schedule, and don't go too crazy with it.
We have a gym, but
I think you'll be surprised. You only have to do it for like 5 minutes. You don't have to do it for hours. In fact, I don't recommend long periods of cardio. I just don't think is a good thing.
I just don't know where to start. I think that's why I want to do Ozempic because now it's like so far gone, and I'm just like, okay, when I was like 200 pounds, okay, maybe, but now I'm closer to 250, and I'm just like. Okay, like
you got 50 pounds of baby or fluid and all kinds of stuff.
That's true. I did lose a lot last time after it, but after it, I just like want to get to it, and everyone's doing it, and it just looks so good, and it's like so frustrating, right? Like
people when they lose all that weight, they look different too. They don't like sometimes how the protein goes down. Also, you got to make sure you nip protein.
But I also feel like those are like thin people already, right? Like bigger people who use it, they look good because they needed the drug, right? But like the thin people use it.
Do you have any sugar metabolism problems or anything?
Unfortunately, no. I always want to get my thyroid because I was like, maybe it's my thyroid, and like you're fine, and I was like, oh, okay, so it's just me.
Did you discuss? Was he just a general doctor you saw? Or
it was just a general doctor.
Did you discuss with him and her Ozempic?
This was years ago. Okay. I haven't been to a doctor.
I mean, it's a reasonable thing to discuss. I just think it's a tool. It has risks. It's being overdone.
Yeah.
I do not like people skipping over or forgetting health and fitness because I still want you to live a long time.
Yeah.
And this does not improve that as far as we can tell.
Oh, that's what I was going to ask. Is it like, because energy wise, like right now I have zero energy to play with my
daughter. But Ozempic reduces energy.
Oh, really?
When you're taking it. That's been my experience, yeah.
Oh, interesting.
Yeah, the weight loss obviously improves energy, but the Ozempic itself, oftentimes people feel kind of
Because I think the only reason I want to lose weight.
Not always.
Oh, okay, because I'm just trying to get energy because I feel when I'm heavier, especially like obviously now I'm pregnant, but like I physically can't do anything, like bend over, go down slides, like any of that stuff, and I'm like, okay, this is 35, so.
Yeah, I mean, I get it. I want you to be as healthy as you want to be. I want you to find your way there. And if you need to be on it for an extended period of time, that's between you and whatever doctor you work with. It just worries me. It worries me. Look, as a friend, it worries me you taking something that I don't fully understand.
Yeah.
And it's being so overdone right now. It can't not have significant deleterious consequences. We're going to find out in the next year or two what really the deal is. So by the time you're through that first year of childhood, maybe we'll know more and you can really make a good judgment about it.
I think I would definitely wait for that year.
Definitely make the first year. Do not do it the first year.
I was ready to get on it right away. I'm like,
I don't think I would do that because you're going to have these mood things and stuff that you're dealing with, and we don't want to add to that.
Yeah. Does it affect your mental?
I mean, the Manjaro goes into the brain specifically. It has a biological mechanism in the brain, but it has to. When you're having so many massive shifts in your biology, you've lost a circulatory system and all those hormones are crashing down. Yeah, adding another hormone blocker, it has to have some effect.
Wait, it's a hormone blocker?
GLP-1 inhibitor, right? Isn't that what it's called?
Oh, I didn't know.
Yeah.
Oh my gosh. Okay, so that's awful. And you said it goes straight to your brain, so it's like telling your brain you're not hungry.
Right. That's one of them. That's not so much the Ozempic.
You said Manjaro.
Ozempic is more here. Yeah.
I think one of our friends is on that one, and I was like, oh, interesting. I didn't
You were
know.
like, oh, you're like guilty.
Yeah.
Jealous?
Well, I was just like, Manjaro, what's happening? Maybe that's better than Ozempic, but you're saying it's going straight to the brain, and I'm like, I don't know.
It actually is more effective.
It is? Okay.
Yeah, but better, I don't know what that means now because it's just so widely used. I don't know what better is yet.
Yeah, well, like you said, maybe in a year we'll see other side effects.
It's funny. I've recommended it to 2 patients
recently.
You did? Both diabetics, both have tried everything to get. It was a perfect. I mean, if you're diabetic, then it really makes sense to do this like now. Both refused.
Wow, really?
Yeah.
Oh, that's so. If the doctor told me like do this, I would 100%. And also like if pre-diabetes, like isn't everyone kind of like pre-diabetic, right?
Seems like it these days.
Right.
Why? What's your A1C? Do you know?
No, I've never had it checked. I'm scared to have it because my uncle passed away like a couple years ago from diabetes complications. He was getting his foot removed, and then
if you have diabetes, you have full excuse then to take
use it. I know. Well, I hope I don't. But
you have a mandate to use it then.
I'm actually, what's surprising to I think so many people and me is like when I go for my like gestational diabetes, they're always like, "You passed with flying colors. You're in perfect health," which is like wild. I pass all my tests. I'm always like, this seems like there'd be something wrong with me because I can't lose weight,
Well, we've been over focused on BMI and scales and things. Those things they're not correlated 1-to-1 with health. You know what I mean? There's many more complicated things afoot here. I'm remarking how incredibly interesting our conversation has been. We have covered so many territories.
I know. That's why I love having you on because it's like talking to someone who like gets it because I'm like I always try to understand things right and then I don't get it, but you like are that missing. You're like
the stuff I get, I get,
which is what I love, and I think that's like so good.
Good, I'm so glad you think about these things too. It's good.
You don't when you don't want to ask your psychologist because you only have 45 minutes and you're paying for that time, and you're like, well, I need to talk about all my problems before I can like ask these questions. So that's why I like when you're talking about postpartum psychosis, and this has been like really prevalent lately. Just as recent as the eclipse, did you hear about the mother who pushed her kids out of the 405?
Yeah.
And the other one who was down in Mexico for like 10 days and left her 16-month-old.
I saw that.
So do you think that is a direct correlation from, because they're all young, right? There was an 8-month-old baby and this was a 16-month-old baby. Yeah. It's a direct correlation.
Well, 16 months is outside of that 1-year window, right? So it makes you wonder. So here's the 3 thoughts. When I see stories like that, A, is that a postpartum depression or psychosis or depression with psychosis? I mean, it happens. All that happens. Is this somebody who already had mental health disorders, severe mental health disorders that's just got worse post-pregnancy, or is this drugs and alcohol? Because those are the 3 situations that do this.
And but you never hear like a follow up, like when you see those women in court.
I know.
It's just like, okay, what was it? You know.
I know, because the world doesn't think the way you and I do.
Yeah.
They think this is a criminal, did a bad thing, bad mother, punishment. When in fact it might have been a poor woman who just didn't have access to a psychiatrist and didn't know that she was severely psychotic or depressed or whatever. I feel. I mean, there's a weird thing that you have to when you think about these things, you got to get a little bit you have to find a philosophy. And my philosophy basically is, and it's not perfect, but my basic philosophy is that I have infinite compassion for you with the behaviors associated with whatever your psychiatric condition is or your drug use, whatever you do when you're altered. I feel terrible for you. Let's get treatment. Let's get better. And I'll have continued compassion for you. To the extent that you refuse treatment or don't do what I tell you, now I'm losing patience. And if the legal system has to step in, that's on you. That's on you. But unfortunately, some people don't know.
That's what I'm saying. How do they?
Yeah, that's just me. Because I'm dealing with these people, all the time.
So, but that's the thing. If you don't know, I just see this so much. It's like, maybe that's the reason I'm always sad. I've been seeing this so much on my TikTok, and it's like countless stories, like one after the other, of these moms doing this to their babies and stuff like that. It's like, how?
Damn,
what
TikTok
do they do?
Is good. They know how to get a pregnant mom upset.
I think that's what it is. I'm like on this side of TikTok, and I'm just like, oh my gosh, it's like the most terrifying thing.
They must see your eyes widen, and you spend like 2 extra seconds on the view.
It's crazy, and I see these stories pop up all the time, and it's like a lot of times people will say, yes, it was postpartum psychosis. There was another woman who did it to 4 children, but it's like if they don't know, like how do people get the help, right? Because this is very common.
This is my biggest gripe, particularly with California, is that somebody who sees that should be able to take that person to care. You should be at your liberty to go, this person is in an altered state, just like if they were demented and running around with their clothes off and didn't know where they were. That's a brain condition. Postpartum psychosis is a brain condition. Both should be treated by people whose brains are working by bringing them to care. In this state, you are forbidden from taking anything except a demented patient to care. Forbidden.
Wow.
Unless that person says, I want care now, and continues to say it all the way through the care process, or they say, I'm going to kill myself or somebody else all the way through the treatment process. As soon as they say, I was just kidding, hands off.
Whoa. So even if they're exhibiting traits of psychosis.
You can't. Go on the street here. Let's see what you find. You see people that could be brought back to a meaningful life. You're not allowed to help them.
Oh my gosh.
Unless they're demented. Then you have to.
What's the difference between demented and psychotic?
Same symptoms.
Okay.
Well, just 2 different conditions.
But why do they get to take a demented person? Wow, that's wild. You need to go to Congress.
And by the way, I have tried.
Really?
And by the way, dementias don't get better. Schizophrenia, bipolar manic, we can make them all the way better.
Right.
And the longer you leave them in the altered state, the more likely you're not going to be able to get them back. While dementias always get worse.
What's like a thing to look out for, like instead of depression versus psychosis, right? Like people, do they know the difference?
Other people or the individual?
Me, like the individual, like, I mean, obviously I know like, oh, I'm not going to like hurt them, but you know what I mean? Like these people, do they know that too in their head?
Not necessarily. So the depression obviously is more sadness, difficulty functioning, being overwhelmed all the time, feeling guilty and ashamed, all that kind of stuff. That's all those negative feelings are all the depression. The psychoses associated with pregnancy are usually wild, like crazy delusions about devils coming or there's something's coming from the outside. I have paranoias, and you might kind of keep it to yourself, which is the hard part. So you get to ask lots of questions. Any concerns? Trisha, anything bothering you today?
Yeah.
But the behaviors can often be extremely erratic. I mean, they get pretty wild.
So people are aware of this, right?
You would know if you were around it. Usually it's pretty wild.
The Eclipse mom, I remember, was like tweeting like the end of the world is coming, and she like stabbed her boyfriend.
Well, and so usually when they kill the children, they're doing it to save them from something worse.
That's what she did. So she crashed her car after. She pushed them out on the 405, crashed, and it was like a Porsche. She was like an influencer, and you're just like, did you not know? Like. But I guess,
did not know.
I guess like you were saying, then she thought she was, because I think the one did survive. The 7-year-old, I think, survived. I think the 8-month-old passed away. But it's like, but the one like leaving her child too. It's like, she just like doesn't think, like they're not thinking about it, or they're not thinking to harm their children. They're thinking like, oh, she's in a playpen, she's fine.
When? So
like there was a mom who left her child in a playpen for 10 days while she went to Mexico.
Who knows? I mean, who knows? Because that could be who knows? That to me is more like chronic mental illness or drugs and alcohol.
Right,
because they just don't know what they're doing.
Because you can like PSA, give your baby to like the fire department or something. Like people will take a baby, you know.
But it's that severe disconnect. You go, what? Particularly, when moms don't do the mothering, there's very few things that can get in the way of that. I mean, really abandoning, like truly abandoning, and drugs and alcohol are number one.
Okay, so it's not necessarily psychosis. That's just like another thing.
Yeah.
It's wild. I mean, it's like that. All that stuff is so
Don't
scary.
worry about it. You're gonna be fine.
Yeah,
But-
no, I'm not. That I would know. I'm aware
but
enough.
you want to do a better job or your best job, and so if there is depression stuff, you gotta.
Yeah, I think this time I will actually like talk to someone. I think before I was like, I got it, I have it handled, because also like I said, the actual happiness overjoys you sometimes too, where you're like, oh, I'm totally fine, like I'm not.
Which is great, and you should tell somebody that, and that's good for the baby and everything. But it's those swings that you want to kind of bring them together if you can.
And then like, it came to the year mark, and it's like the swings like went away. It was like very.
Which is great.
I mean, still gets overwhelming, but at least it's like, oh, it's a baby, like this is just what babies do. And as opposed to when they were younger and I was in my mood swings, I'm like, I don't know what to do. I'm a terrible mom,
I know. Everybody feels some of that stuff. Even doctors feel that way.
Yeah.
I felt overwhelmed and crazy.
That's so interesting too. I always think, you think doctors are just like perfect. Like you just come across as like perfect beings.
No.
So I love when you talk about all your issues, the codependency.
Right, codependency, depression, panic disorder. I've had everything.
I didn't know all that.
In college, I had severe depression with panic. And then I was mismanaged, which got me interested in treating adolescents because I'm like, I don't want this to happen to anybody else again. This was terrible.
Yeah, that happened to me too when I was like young, and they just like, they think you're crazy and stuff like that.
Oh, I remember I went down to the student health services. I didn't know what was happening. It was a panic attack at the time. And he goes, you need to get it together. Just take some long walks in the woods. And I was like, I would if that would take care of this.
Did you do it?
I'd already done that. I tried all that. It's like impossible.
Isn't that crazy? The anxiety one's wild. They're like, just stay calm. And you're like, okay. It's like,
oh, yeah, sure. Just stay calm.
Have you seen the Baby Reindeer on Netflix?
No.
Oh, it's about a stalker, but like they both, like she's obviously very mentally unwell. It's based on a true story. And it just came out. It's like this new one. So that's why I thought when we were talking about all this stuff, like how they kind of have.
All right, I'm going to watch it. I've been busy with Benjamin. It's on Apple.
Oh, I haven't seen that
Palm
one.
Royale, which is real. I think you would like that.
I love Palm Royale. Yeah,
Did you see it?
Of course. Yeah, that one's great.
So
I love that you
clever.
watch just like those kind of shows. I always think you want to watch like psychological, like something.
No, it's a busman's holiday. Then I want to get away from all that.
That's true. That's true.
Though I like history and stuff like that. That's why the Benjamin thing. So.
What's Benjamin's about?
Sorry, Franklin. It's called Franklin.
Oh, okay. Yeah. About Benjamin Franklin.
Yeah.
I know nothing about him other than like Hamilton, and he was on the $100 bill.
You might like this because it's about his trip to France where he makes the deal to get the French involved. That's how we won the revolution. People don't realize that the French is why we won the revolution.
I actually don't know any. Like history, I'm just the worst at. But because to me, it's like, what's the point of learning about it?
I used to think that way too.
Yeah.
And I realized probably in the last 15 years, because I was always very just interested in the psychological and in the neurobiological, and then the community and the family systems and the relational part. But then I started looking at the sweep of how these things change, and I thought, oh, damn, all of these phenomenon that I'm so interested in always happen in historical context of how people are parented, how they're reared, how they function in society, what they're faced with when they get there. And it really does impact all these other things I'm interested in. And so I felt like I really have to get my head around history, at least the last 150 years, to understand what's going on now.
So what did the Franklin one teach you about now?
I've been, oh my goodness, Trisha, you're going into my head deeply. So I have become preoccupied with the French generally.
Oh, okay.
For the last year.
So like a Francophile or something,
I am a Francophile.
Yeah.
I've always been a little bit of a Francophile, but I got obsessed.
Okay.
Long story again. We have time for this? Am I
yes,
okay.
I love your obsessions. I didn't know you have obsessive personality.
Oh, for sure.
I didn't know.
Well, anxiety goes one of two ways. It's either depression. People that get anxious get depressed, or people with OCD get anxious.
Oh, interesting.
I'm on the OCD side.
Okay, got it.
For sure. I had bad COVID, and then I got long COVID, and I had terrible brain fog. And we were going to Greece that summer, and I had this feeling that if I worked on languages, music, or dance, it would help clear the fog. I don't know why I felt that way, but I just had this very distinct feeling. So I said, I'm going to learn some Greek. And I started working at it, and in 2 weeks, my brain fog cleared. And I thought, wow, that's amazing, noted. And I learned Greek way faster than I should have. And when I got to Greece, everyone was sort of shocked at how well I could kind of get on with Greek. So there was something weird going on there. I don't know what to make of that.
Yeah.
Maybe not real, but that did happen. And when we got back, I studied French for many, many years, and I could never speak it. And I could never understand why I couldn't speak it. And I went, I'm going to get my French together. We're going to finally get this together. Well, Turns out the spoken language is very, much different than the written and the reading. Because I used to read and write in French, and it's totally different when you speak it.
Oh, really?
Oh, yeah. It's like they speak like 4 different languages.
You could read and write, but you couldn't speak it?
I just couldn't. I couldn't get it. I couldn't.
Oh, interesting.
And I knew the grammar inside and out. My vocabulary turned out wasn't that strong, but particularly my vocabulary for the spoken, they mess around with that language so much. They have a formal language, a familiar language, a slang language, and then they have like a pig French, where like pig Latin, where they just inverse words.
Oh.
It's called verlan.
They still speak it over there?
Yes, they do all the time.
Oh,
They move back and
gosh.
forth amongst these.
French are wild.
And they have certain phrases they use. I had to learn all that anyway. So I did that. And when we went to France, and when I was there, the youth were in the streets demonstrating against vaccine mandates. And it caught my attention. I'm like, well, back in the U.S., they're demanding more vaccines and more masking and more stuff. This is very different. So I started talking to these young people, and they're like, look, they told us this illness is not going to harm us. We're young. And then they're going to force us to take a vaccine. That's against the founding principles of this country, liberté, fraternité, égalité, équalité. And I just thought that was so interesting. So I started watching and listening. I started listening to lectures in French. And then I started then the film Napoleon came out. And I went, wait a minute, that didn't seem too accurate to me. And the French were all upset about it.
Is that the Joaquin Phoenix one?
Yeah.
Oh, yeah.
They're all bent out of shape about it. So I started going down this rabbit hole listening to lectures on Napoleon and then the French Revolution in French, ostensibly to improve my French.
Okay.
But I just kept going down this rabbit hole. And I'll be damned if there's not a lot of correlations to our present situation. A lot.
Really? Like
A
what?
lot.
From Napoleon to
the,
now?
The mob that we talked about earlier, right? Then we talked about mob action, how people are scapegoating and mobbing.
Oh, right. Yeah.
So that was sort of
I
French
see.
Revolution on steroids. We're back to that again. The guillotine is the cancellation process. It's just that's what we're doing. It's scapegoating, trying to harm people. And was a fundamental conflict in that sort of issue in that culture between centralizing authority and decentralizing authority, and that was my big problem with how COVID was managed. It was too centralized. This centralizing public health authorities who made terrible decisions, didn't make risk-reward analyses, and hurt people. And so. Anyway, it's all back to the same stuff again.
So you got into the French, and now you're like, Franklin, he's French?
Oh, he's not French. Okay. He goes to France and deals with the court of Louis XVI to make the treaty to get the French into the French Revolution, which we needed to win the war. We wouldn't have won the war without the French.
What if we lost the French Revolution? What would have happened?
The American Revolution.
Okay.
The French Revolution,
any revolution you're
nobody
talking about.
lost. Napoleon just stepped in and went, stop all this bullshit. I'm taking over here.
Oh.
Our revolution, we'd be British, I would guess, and
that's not that bad.
And probably be 13 different countries that sort of ran across the whole country or something.
Oh,
Yes.
that's not a horrible alternative.
You can look at almost any war and go, what would have happened if, and you go, well, it wouldn't be so bad.
Well, I mean, like World War II. I mean, if we lost that, be under Hitler's, that would probably be bad.
Few people would be in trouble, yes.
Yeah, but I feel like that one's not a biggie.
Yes, there's some that are easy.
Okay. So you're interested in those kind of things. That's interesting. I don't know.
Yeah.
I never got into the French whole thing, but
you're not alone.
Okay.
This is a weird thing I did.
That is so interesting. I wonder why you do it. I wonder, is it because you said it cleared your mind when you did Greece? I wonder if it's like it's almost like meditation. You can't think about anything else because you're so focused on learning Greek.
It is a specific part of the brain, and we don't know what. It's not all that fully understood, all the biology of language, right? It's actually right here in our brain. It's right where I put my hand, which is weird. And it probably deploys multiple other regions. It's probably an integrated function that we can access more easily than other integrated functions. And that's probably why it helped me.
Interesting.
And think about dance, too. It's also very integrated.
Did you do that? Did you learn dance?
I didn't. I went down. I almost did. But in terms of, now you have motor, you're integrated with motor, you're using the language centers because that's where music kind of gets in.
Right.
And so it's, again, that sort of integrated function that I must have been looking for.
Did you ever do Dancing with the Stars?
No. I've been asked to a few times.
Wait, and you said no? You like
because
dancing.
I kind of feel like I'd have to train for a year to it'd be so embarrassing.
No, that's like the whole point of the show, right? Train and
yeah, I know, but it'd be so. I also don't have the time for that. They've been lurking around a few times, yeah.
Oh my God, you got to say yes, especially now. I feel like it's making a comeback.
If you do it, I'll do it.
Okay, absolutely. Get me on anything. I'll do anything. I would do every show.
We need to get you on TV.
Possible.
Sure.
No, I don't know what it is, but I would love it. I think I'm just not TV friendly. I'm a little chaotic. I'm too canceled. I'm too I'm only you, Dr.
Too controversial?
Drew. Yeah, I think that's what it is. I don't know why. I mean, when I look back at some of my controversies, we talked about it last time, which we broke through and did apologies for. People were very excited about it, you know what I mean? But,
good.
But yeah, I don't think I was like some of these people, you know what I mean? Oh.
Well, it's what you were in a weird and interesting way. You weren't necessarily, it was controversial at the time.
Yes.
But not so controversial now.
Now compared to things, I'm just like, I think I was pretty
right?
chilling,
Tame compared to what's going on now.
Did you watch the Quiet on Set Nickelodeon?
I did not. I've thought about watching. I should watch it.
Oh my gosh. Basically, I had one of the child stars on the show, and we were talking about how on reality TV, I've done like Celebrity Big Brother, I've done Who Wants to Be a Superhero, like I've done all these shows, sci-fi, all these huge ones, and they always had therapists. Like Big Brother,
yes.
Like they don't show it, but like they'll have a therapist come and talk to you.
Oh my God. I did that Special Forces thing where I went to the desert. Do you know this?
Oh, just recently? Was JoJo Siwa on it?
No, that was the second season. I was the first season, and I did the reunion with JoJo's group.
I didn't know.
But that therapist, that was a year and a half ago. That therapist still contacts me.
Wait, what were you doing on it? You were on it?
I was a recruit. I was a recruit. Look that up. Look up Special Forces season 1.
Wait, what? Because that was the one like JoJo's.
I ended up in the hospital. Me and Mary.
Who was on with you?
Kate. It was a great group. It was like Mel B and
who's the Kate? Which Kate? Kate plus 8?
Yes, she and I ended up in the hospital very quickly. We were the senior statesmen, and we were like, poof,
oh, is it a physical show?
Oh my goodness! Oh my God! We both ended up in the ICU.
Wait, but she's like. She's
I'm
like
older.
young.
I'm a lot.
Okay.
We were the older folk on the show, but
oh my gosh,
we were both in shape. What? Oh, there I am in soldier.
You?
In soldier outfit, yeah.
Wait, when
but
was
look good.
that?
Get some tape. It was a year and a half ago. We had Mike Piazza, Danny Amidalo.
Oh my God. No, you actually are like so ripped. I know I was watching you, I think it was Brian Callen's podcast, and they were showing you like all like ripped. And I was like, oh, I had no idea. Like, it's crazy.
Well, I've gotten more. I've always been around gyms and stuff like that. I always like that. It's always been that's my meditation. And that's where I listen to my stupid lectures.
I love that. I need to get into that meditation.
And I really have been lately trying to do stuff with health and fitness organizations. I do this thing called V-Shred, where I've decided it's really time for me to find ways to get people to do the diet and exercise they need to be doing. I've been saying it forever. You have to. It's something you have to kind of promote. You have to do it actively for people.
Yeah, it's kind of hard. People have to like get there too. You can like promote it, and people have to like get there.
And there are ways. So just to say it's something it's important doesn't go very far.
But what were you saying about your therapist on the show? There was a therapist there for you guys.
I was saying a year and a half later, he still kind of reaches out once in a while.
So there was somebody on set every day with you guys.
That show was highly traumatizing. We jumped out of a helicopter. Show was going out of the helicopters.
Oh my gosh!
Just say special, or just get the trailer. You'll see all this stuff.
I didn't know. When does it air on?
It's a Fox. It's a Fox.
I never heard of it before
time.
JoJo did it. I'm like on it. I watch Traders. I watch everything. Like, that's so crazy.
Yeah, it was a good show. It was very well done. So well produced.
So it's like psychologically and physically.
Everything.
Why did you want to do it?
Because they called me and I was like, oh, come on. I go, oh, you need an old guy in the cast, right? You have certain things you have to fill. I go, okay. I go, where are you going to send me? Utah? And they go, no, the Middle East. I go, what?
Wait,
where did you go? Jordanian desert.
What?
Yes. We were in the Wadi Rum Desert. It was 120 degrees. I ended up with heat stroke and dehydration and everything.
Yeah, that doesn't sound safe, just period.
It was not safe. And the trainers kept going, if you die, that's just nature's way of saying you failed.
Were they being real or was it for TV? Oh my gosh.
You were never aware of cameras. Everything was all hidden.
But what was the point? What were they trying to show on the show?
Really, the point we all wanted to make was first of all, how extraordinary people there in Special Forces are and the sacrifices they have to make to do what they do.
So it's about celebrities
doing
training.
The Special Force training, yeah.
What Special Force? That's like military?
Like Navy SEAL training.
Oh my God. That seems not a good idea to have celebrities doing that. That's the last people that should be doing that. Jeez.
See, you have good sense. You have good judgment. Not so much me. So what happened is they called me and they said, we're going to do it in a month. I'm like, how am I going to do that? I kind of figured out a way I could do it. And then I started training the way they wanted me to train. And I was feeling kind of down then. I was sort of depressed and I didn't have a meaningful direction. And as I started training, I started really responding to the training. There was an intensity to the training that was
like endorphins.
Something made me feel better. And I thought, well, maybe this is what I've been looking for. I'm going to go do this. And so I committed. I'm all right, I'm going to do it. And interestingly, it bonds you up, man, with those people.
Are you close with Kate still?
Kate, I just called Beverly Mitchell this morning. She's from
Seventh Heaven?
Seventh Heaven. Yeah, she was
Wait,
in there with
what?
us.
That's so
she was
funny.
There. Danny Amendello from the Patriots and I are still friends. And Piazza, I'm going to go to Italy and see him next fall.
Who is it?
Mike Piazza, Dodgers.
Oh, okay.
Mets.
Yeah,
Yeah.
Did you have to do a physical beforehand?
Yeah, you do a lot of stuff, all kinds of VO2s and things. But
there's no 60-year-old special forces person,
I know.
so that's not fair.
I think I've noticed in season 2 there were no old people in there.
Yeah, that's no matter how fit you are, you could be Ernie
right.
Hudson.
That is absolutely true. And
Yeah.
I got the message.
Yeah,
and so did they, I think.
Crazy.
See, look how good your judgment is.
I know. I was like, wait, I'm making better judgments than Dr. Drew.
Absolutely. But Jamie Lynn, when I started getting sick, I was having these headaches and I was getting weak, and I didn't want anybody to know because you're so much about the group and protecting everybody, and if you get in trouble, the whole group would get in trouble. And Jamie all of a sudden grabs me and she goes, "Come with me," and pulled me into the doctor's office and just like, "He's not right." And I didn't know where I was.
Wait, what happened? Was it like
it was like heat
vertigo,
stroke? No, I just was what's called encephalopathic. I literally was out of my mind.
And you didn't know? You weren't aware? You couldn't be aware?
I was aware, but I was hiding it, but I didn't know how bad I was. I was bad.
Oh my God, this is like a doctor that was like, didn't know. That's so, the physical doctors on set too. They have the therapist, the physical doctor. Yeah. Oh my gosh. And you just want to do it because you're just like, didn't know where you were going to do in life. So you're like, you didn't have a direction, you said. So you're just like, I'm going to do this.
I'm going to do this. I'm glad I did. I met some of the dearest friends. I mean, close. We are so close. It's so interesting.
I don't think you pay me $10 million to do that show. You didn't see it, Moses, but there's like, they crashed a Jeep into like the water and it was started like to sink. And I was like, why would anybody want to learn that or do that? Like, they're not going to go join the military after this.
No, but they indoctrinate you so fast into the group. It's really interesting because at lunch, day one, Kate, we were all silent getting lunch. And Kate says all of a sudden, she goes, "Look at us. They've already changed us." And we were all like, yeah.
Really? Oh my, I don't know. Reality shows like that, I'm just kind of like, little exploitative, maybe. I don't know.
Do you know JoJo? Is she a friend?
I don't know her that well, but
I mean, you should ask her what her experience was like.
She's kind of blowing up right now. I think she's too popular, but I used to know her, and the whole Kid Star thing. I always have like, I don't know much about it, but I always have like opinions, especially after seeing that documentary. Which I was going to ask then about the therapist. That's why I got to talk about reality shows.
Yeah.
Why they don't have it on children's shows?
They should.
Like, because
it's insane that they don't.
They would get bullied.
They'd have teachers, but they wouldn't have therapists, I don't think.
Yeah, so this girl was getting bullied by not only her co-stars, the other females in it, but like the producers were bullying her. And so I'm just like, why is there no one around? If there's like people for reality shows, how come there's no one around? Even to this day for kids shows. Like, you think that should be, I was like, oh, that's so crazy that they wouldn't have someone to talk to.
Yeah.
And they isolate them from their parents and stuff like that. They take them. So it's just like a whole thing. The Quiet on Set's pretty interesting. You should watch that.
I'm going to watch it.
And Baby Reindeer, I feel, is another one about stalkers.
Baby Reindeer, okay. Two. Those
are because they're all like psychological, right? And even the stalker had issues. The guy being stalked had issues too. He was like had trauma that he was spiraling from. And it's just so interesting. I saw myself in both the stalker and the person being stalked because he had trauma from an assault from like an older man writer that was his mentor, and then this girl.
Interesting.
But then he didn't want to put the girl away, the stalker, because she also was like failed by the system and she had a lot of issues that was like untreated.
So interesting.
Yeah,
that's I think I need to watch that because I like when things are not all black or white, because things are usually much more conflictual.
That's what it was. They didn't paint her to be this monster, and what's even more interesting is the guy who's starring in it is the guy who it happened to. So he got the restraining order. She got 5 years, I think, in like prison, but he didn't want to put her away for like life. And stuff.
I had a stalker who was terribly psychotic, and he tried to hurt me and my kids and everything, but he was a meth addict. And there's a department here, a stalking department in the DA's office, and they are amazing.
Yeah.
And they did the whole thing, got him, and they go, "What do you want to do?" And I go, "I want him to get treatment. I mean, he's a sick person." And so they committed him to years of treatment.
That's, I think, what happened with this guy. He didn't want to put her away. He like maybe sent her away.
Now, if my position, remember, so he did great, and 2 years, kind of normal person. But if he goes back to drugs, now I want them to throw the book at him, because now you're a dangerous person. You're not committed to your recovery. Wow. You're not, no more. That's it. You get a try, and I'll go to the mat for you. But if you're blowing it, now the legal system.
He was one of your patients.
No, somebody just randomly.
He just saw you on TV.
So I guess.
Oh, so you had no
contact. Yeah, I didn't know him.
Oh gosh, I would think of that with your patients too. I would think maybe they become obsessed with like their doctor or something.
There was some of that stuff, but I'm usually able to kind of handle that. So
I definitely had 2 obsessions with like a doctor when I was like younger, and I was like really, and then they also what?
Hmm? They They
also
responded.
kind of like fed into it. They're kind of like
See,
trying to be my friend.
That's the part that drives me crazy.
Yeah, and it's like
because once you develop that, whatever it is, whether it's an affectionate transference, an erotic transfer, whatever it is, that's where the work starts.
Yeah,
that's where the boundary gets set, and them to take advantage of that or not be able to do that. That disgusts me when doctors do that.
Yeah, because I was like 17 one and 19 on the other. So that's why I was always very against therapy, because I was just like, and being 17 and 19, and you think
that's the other thing it does. It biases you against the safety of that environment.
Yeah. And then you think like, oh, this is a really smart person. He's older. You'd like that bond because you're like, oh, this person likes me and I'm not one of their crazy person. Right. And they would tell me that, right? They'd be like, oh, you're not like all the other crazies and stuff. So you're like, okay, I'm good. Whatever I mean.
The basic experience of therapy should be the therapist not saying very much, if anything.
Yeah.
And it shouldn't make you necessarily feel better after a session. You should be stirred, if anything, after a session.
Yeah, no, comforting. What about physical touch?
No.
Because that was always like the thing. I remember early on, this is like 2006.
It's okay for somebody to, may I touch you, and to be leaning in and touching with like one hand, one spot.
Not like a coddle.
No.
I think that was so many. And not just these two guys. It was like, there was like a female. And it was very common to like just be like arm around. And you like that, right? Like you like a sense of like, oh, that's nice to have an arm around you.
I don't mean that it's sinister. I mean, it's further messing with the boundary issues that you're trying to fix.
Right. Even though it wasn't like SLA where I was going for them, it was more like, I just thought there was like something wrong with my brain.
I know, I get it. But we've discussed several times that boundaries are a major thing for you, and me too. and that all that messes with your ability to heal that.
Yeah, it is interesting. Yeah, I feel like now maybe people are more like woke to that kind of stuff and know that's like whatever. But remember back in the time, you're just thinking like, oh, it's like cute or whatever.
Well, there actually was a time when that was kind of encouraged. In the 70s, everything went off the rail. Everything.
Being like,
Be fun, be nice, be
the friend.
Be a friend.
Yeah.
It's like friendly moms, friendly parents, same thing.
Right. It just kind of messes with people. Well, I'm very excited. I'm very excited for you to watch Quiet on Set and Baby Reindeer, because I think those are two like those are questions we got asked a lot from our Patreon, because I was asking, which we're like out of time now, but like the Patreon questions had so many people asking your opinion on those shows, because it just like really gives people, like what we were talking about, like insight into like this is a real thing, the stalking, the children's stars of it all. We talked about that last time too. But and it just really, I think it's interesting. I love when people like share those kind of like stories and they're out there in the mainstream. It's on Netflix.
Look at it.
Well, thank you, Dr. Drew. I really appreciate you coming.
It's always so
here.
fun to see you. I miss you when I don't come in.
Thanks. I love seeing you. You're a favorite guest. You're the most recommended. I'm telling you, every guest who comes on is like, I should talk to Dr. Drew about that. And
Maybe we should do a little group sometime.
That would be everything. Anyways, check out Dr. Drew. Ask Dr. Drew. Is it on Facebook or?
So if you go to drdrew.com, pretty much everything is there. Go to my Rumble channel. It's Ask Dr. Drew.
Ask Dr. Drew.
Twitter,
and what was
Dr.
the kit
Drew.
one? I thought that was important.
drdrew.com/TWC. So it's the wellness company.
Yeah, check
important.
that out. I think that's very important. So thank you, Dr. Drew. Have a great weekend. I know you're taking off soon, and enjoy your weekend.
Thank you.
Thank you.
Bye.